Don't avoid treatment. Quick beginners catch the risk of death and illness. Sakalameta wambea, sakalameta wambea, sakalameta wambea. Results of that study. Kalaba kalambala, kalaba kalambala, kalaba kalambala. Early treatment. Now I know the benefit of my treatment. No delay, I gotta start right away. My treatment game changer. Results of start study. Let every nation strive to put all folks on treatment. Ladies and gentlemen.
Yes, put it down, 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 DJ. Akaimba message mujitegede, mukagade. Help me pass the message to people living with HIV to take their medications correctly. Katika sinna vako stage kamba wakasembayo. Kana akasembayo bakaita hear her cry. There is an emerging issue in Uganda. Young girls are being defiled in almost every district of Uganda. Young girls are being infected with HIV. We need to fight this cropping up disease. In one district of Uganda called Moroto, 6,000 young girls were defiled in the first lockdown. 6,000 young girls below the age of 18 defiled in one district. That's terrible. We need to stop this disease. With Uganet, I produced this song. Give me the song, Hear Her Cry.
Hear her cry. Hear her cry. This voice is calling you for the rights of young women and girls. Tetuba tulugunya na uwantu tubalekere kamgetembe yawe. Hear her cry. This voice is calling you for the rights of young women and girls. Tetuba tulugunya na uwantu tubalekere kamgetembe yawe. Hear her cry. Tubadde kyabami lwaki tweyisa ng'ensolo. Kutulugunya omukyalo oba omuwala ekyo kiva ennyo. Osange wa Katonda ne mu kkooti gwa Nnagomola. Omwana gw'otulugunya fitayo gisudde mu nnyanga kikomye leero. When kikomye leero. Listen. This voice is calling you for the rights of young women and girls. Tetuba tulugunya abo bantu tubalekere bamgetembe yawe. Hear her cry. Stop it. This voice is calling you for the rights of young women and girls. Tetuba tulugunya abo bantu tubalekere bamgetembe yawe. Hear her cry. Last message. Ab'obuyinza mu ggwanga n'abazadde muwulire bino kibakakatako okulwanyisa kabava yonna gy'obeera. Temubikkirira misango mubatwale bawozesebwe. Bamukulya enguzi bulamu bw'omuntu bw'ozannyirako kikomye leero. Sing it with me. This voice is calling you for the rights of young women and girls. Tetuba tulugunya abo bantu tubalekere bamgetembe yawe. Hear her cry. Can you sing with me? I can't hear you. Let's go. This voice is calling you for the rights of young women and girls. Tetuba tulugunya abo bantu tubalekere bamgetembe yawe. Hear her cry. Omusembayo. This voice is calling you for the rights of young women and girls. Tetuba tulugunya nabo bantu tubalekere bamgetembe yawe. Hear her cry. Thank you so much, Uganda AIDS Commission, for always giving us the platform. Thank you so much, USC. Thank you so much, Uganet.
and everybody around. Please, people living with HIV, take your medications. Chance whenever we shall come back and entertain you more. Thank you.
Thank you. Thank you very much, Stigmaless Band. Okay. Thank you very much, Stigmaless Band. I think we couldn't have started our session in any better way. I would therefore like to request Miss Hope Murungi to come and give us an opening prayer.
Good morning to you all. Let's humble ourselves and pray. Dear Lord, we thank you so much for this morning. We want to thank you specifically for each individual person that is in this room. And for those that are yet to join us, we thank you for the gift of life. We thank you for the 3 days that we have been here, thinking together, looking back, looking at the journey of HIV and AIDS in this country. We thank you, Lord, for the gains. We thank you, Lord, for the achievements. We thank you, Lord, even for the difficult times. Above everything else, we thank you because you have been God. We thank you particularly for this day as we commemorate and remember the work that Lutaya did in this country and beyond. We want to invite you to come and be in our midst. We want to pray that there will be calm, there will be peace, there will be stability in our midst. We want to pray that His Majesty the King, as he comes and spends time with us, it will be indeed a great moment. We pray, Lord, that you will send your support through your angels, through your Holy Spirit, to lead and guide us throughout this day. We pray that it will end well. We pray that we will go back encouraged, with fresh minds to keep on the fight. We know that with you we can never fail. We can never go wrong. Bless our work. Bless every individual person, the partners that are in our midst, the ambassadors, the champions, and every person in their respective capacities. We thank you for our government and for the leaders that will also join us later. We pray that this will be a good day. We trust in you and we have no doubt that you are with us. In Jesus' name we've prayed. Amen.
Amen. Thank you very much. May I take this opportunity to welcome our session chair, who is none other than the chairperson, Uganda AIDS Commission, Dr. Eddie Sefuluya Mukoyo. As he makes his way to the podium, allow me to quickly notify you that on the program, we are supposed to have a recap of what happened yesterday. We also expect a statement from the UN resident coordinator. This statement is supposed to have been made beginning at 10:10. So we'll have an adjustment. That is what will happen first, and then we will do the recap. So please bear with us. Our participants online, we want to apologize for the delays, but we hope to start very soon. So after the recap, we shall receive a statement from the young people living with HIV. That will be followed with community perspectives in the national HIV response, which will be followed by a keynote address on regional perspectives on HIV and COVID-19. We shall then have a presentation, an audio presentation from our very own Tezra Lutaya, and we shall also have an award before the main event of the day. So it is kind of packed,
ladies and gentlemen,
but we believe that we shall be able to get all that done before we go into the closing ceremony. Once again, you are most welcome. May I invite Mr. Kraish Mubiru to come over and Miss Dorothy Namtamba. Mrs. Enid Wamani, please join us as well. So, Chair, we are ready. Like earlier indicated, we will start with the remarks from the UN Resident Coordinator, Her Excellency Susan Namondo, who is online, and our apologies once again. We should be able to start now.
Good morning, everybody. Good morning. Good morning, everybody. It's not working. Good morning, everybody. I would like to welcome you all to this third day of our meetings that we've been having here, the scientific conference, the joint AIDS review, and now commemoration of the Lutaya Day. We've been running late, and we already have Her Excellency Susan Ngoji, the UN Resident Coordinator, online. And I will request that she gives her remarks before we proceed further. Her Excellency Susan Namondo. Yeah.
Thank you so very much. I think I'm online now. Good morning to everybody, and thank you so very much. And my apologies for not being there with you in person. Truly sorry for that. We're managing the schedule as best as we can. I'll start my statement now. I want to start firstly by recognizing the Minister for the Presidency and King Oyo, who I understand are not there yet, but will soon be joining the gathering. The chairperson of the HIV Committee of Parliament and all honorable members of Parliament who might be with you right now. The session chair and chairperson of the Uganda AIDS Commission and all board members who are there now. The chairperson and representatives of people living with HIV in Uganda. Recognizing also
We are just experiencing some technical problems, but she should be back online shortly.
I am back online. Apologies for that. Let me start by expressing our solidarity with the government of Uganda and renewing our commitment to work within the multi-stakeholder framework towards ending AIDS as a public health threat in Uganda by 2030. I commend the government of Uganda for its leadership in fighting against HIV/AIDS in the country. And this leadership, I understand, spans the arc of His Excellency the President, all the technical experts, and the persons living with HIV/AIDS themselves. The HIV/AIDS burden has been on steady decline since the 1990s, and currently my understanding is 5.4% of adults are affected by HIV and AIDS. And Uganda was only one of the 8 countries in the world that really managed to reach the UN targets 90 at the end of 2020. So congratulations for that enormous achievement. However, as is always the case in the work that we do, there's always more that we can do. So despite the really impressive success, Uganda remains among the 10 high-burden countries. So there's still plenty that we should be doing. New infections are still very high, especially among adolescent girls and young women. And inequalities in terms of accessing services still remains. And something also, and I think that came with the band that was entertaining us, there's a very strong relationship between sexual violence in our context here and HIV infections. Media reports are awash with news of escalating teen pregnancies, worsened in the last 2 years, as we all know. The statistics that we have from the police crime report for 2020 reveals an increase in domestic violence. Even more alarming, as has already been mentioned by many before, are the cases of increased defilement. And this increase in sexual violence, which in its own right is quite dramatic, also has a very negative effect on the HIV epidemic. In 2017, His Excellency the President launched the Presidential Fast Track Initiative for Ending AIDS by 2030 in Uganda, and they include 1, engaging men in HIV prevention and closing the gap on new infections, particularly among adolescent girls and young women. 2, accelerating the implementation of test and treat in order to attain 90-90-90. 3, consolidate progress on elimination of mother-to-child transmission of HIV. 4, ensure financial sustainability for HIV/AIDS response. And 5, ensuring institutional effectiveness for a well-coordinated and multi-sectoral response. The Presidential Fast Track Initiative showed the government's commitment to the goal of ending the AIDS pandemic as a public health threat by 2030. The framework, especially in reaching 90-90-90 at the end of last year. But a concern is that our response, HIV response, is really highly dependent on external resources. My understanding is 80% of the external resources that we get for this response goes towards drugs and commodity supplies, which leaves a significant gap for prevention programs, such as mindset change that we need to do around the social and cultural drivers of the epidemic. So we really need to all collectively advocate for sustainable domestic financing to ably prevent new HIV infections as we ensure that all the 1.4 million people with HIV that need ARVs have access to those ARVs for life. We as the UN do note efforts made by the government towards innovating financing mechanisms The most visible one is the mainstreaming of HIV in all the sectors, which aimed at greater sustainability. We also recommend the operationalization of the AIDS Trust Fund and the National Health Insurance so that it can expeditiously ensure more predictable financing for HIV response, especially during this COVID-19 pandemic. My understanding is the conference has really highlighted the many areas that we need to focus on. From the UN point of view, we see the following three as the most critical to focus on at this time. And the first is really addressing the escalating rates of GBV and teen pregnancy that we have seen during this COVID pandemic in Uganda. Prior to the pandemic, young women and adolescent girls comprised 33% of all new infections in Uganda, and the prevalence of HIV among women aged 20 to 24 was 4 times higher than men of the same age. While we understand that schools are going to be reopened in January, and some of these pressures will be alleviated, the situation still remains very dramatic. There's need to ensure that girls and young women in and out of school have adequate knowledge of HIV prevention measures, access to sexual and reproductive health services, as well as resources to be able to address harmful cultural practices. And of course, we also need to address the fundamental issue of power dynamics between males and females, but this is a global challenge, long-term challenge. The second issue that we think is really of great importance and needs to be addressed is that even as we address the complacency around HIV/AIDS, which has been exacerbated by the efforts that we necessarily had to put in terms of fighting the COVID-19 pandemic over the past 2 years. So we need to find a better way as we ensure systemic focus on COVID and SOPs and vaccinations and the socioeconomic impact. As stakeholders, we need to make sure that everybody also receives the public information campaigns about HIV/AIDS. And third is really making sure that we continue to mobilize stakeholders, financial and other resources towards the AIDS epidemic. We need the sustained leadership and better coming together through international cooperation and meaningful community engagement to urgently accelerate our national, regional, and global collective efforts towards comprehensive prevention, treatment, care, and support, and to ensure that absolutely nobody gets left behind in the response. So from our end, first and foremost, GBV and teen pregnancies, better attention to the HIV/AIDS, even as we battle the COVID pandemic, and mobilizing all partners and their resources to ensure equitable and quality response. The UN system in Uganda, especially through its joint program comprising of the 13 UN agencies, FAO, ILO, IOM, UNAIDS, UNDP, UNESCO, UNFPA, UNHCR, UNICEF, UNODC, UN Women, WFP, and WHO, remain very committed towards ending AIDS as a public health threat in Uganda by 2030. We will continue to join hands with Uganda and pledge our support towards your policy work, your programs, your capacity building work, and your coordination work. I'm really grateful for the organization of this conference, and my understanding is it has really allowed us to come together, assess where we are vis-a-vis where we would like to be, and coalesce in terms of the consensus that's needed on the key actions that are likely to get us there quickly. And I really look forward to our collective work ahead on HIV and AIDS. And with that, I'd like to end my remarks, and really sorry that I could not be with you at Hotel Africana. I'll make sure that next year I redress the issue and I'm there fully. Thank you very much.
Thank you very much, Your Excellency Susan Namondo, UN Resident Coordinator. Let's give her another round of applause. for her statement. As you all know, today we honor the legendary Fide Lutaya and those who have succumbed to AIDS disease. We shall have a memorial lecture that drums up the call for individual and collective responsibility to end stigma and discrimination against those living with HIV/AIDS. We had to start with the resident coordinator because she was already online and she had other urgent duties. But I would like to take us back to the program where we have Eni Duamani, who will give us a recap of day 2. You're most welcome.
Thank you, Chairman. All protocol observed. Good morning, ladies and gentlemen. I will take us through the recap of day 2, which was yesterday. And just to note that it's highly summarized because USC is working on the abstract book that will be availed on our website. So please bear with us. The details will be right in there. So yesterday we had several presentations, both in plenary here, but also in our breakaway parallel sessions where we had abstracts presented. And yes, the first session was chaired by Dr. Fred Makumbi, followed by a recap. And the first presentation was from Rakai Health Sciences Program. We were looking at evidence-based programming, how do we move from research to practice, and they focused on comprehensive prevention as an effective way of reducing HIV infections. So they shared with us their program interventions that have been proven to be very effective in reducing infections, and it was really very informative. Those of you that didn't miss, please make sure that you look up the details in the abstract when it's shared, abstract book. That presentation was followed by the National Research Agenda, a presentation shared by the Head Prevention, Uganda AIDS Commission. And this research agenda provides us with a framework for identifying research questions. So what do we need to focus on as we move towards our targets for 2030? What are those salient areas that we should be digging deeper to research about and inform our policy and programming? It provides us with guidance on how we conduct research for the national HIV multi-sector response. That was followed by a presentation here in plenary on new and emerging evidence-based interventions in care and treatment, a presentation that was given by Dr. Francis Sully from the Joint Center for Clinical Research. Joint Clinical Research Center, my apologies, from JCRC, and they presented to us their interventions, how they go about, but the focus really was on the need for us to look at the need for early linkage to care in order to realize viral load suppression at 12 months. So there is a lot of detail, a lot of science that was shared in there. Again, details are available, and the next presentation after that was a demonstration by Uganda AIDS Commission, the head of ICT, who showed us how to navigate through the virtual exhibitions online. It was a very fascinating exercise. He showed us online how do we easily navigate moving across the different exhibitions that are being made by partners. And yes, that was most informative and very interesting technology there. Then we moved into the parallel sessions. We had some in the morning and some in the afternoon, and several papers were shared, but very briefly, I'm missing the first track, focused on epidemiology and prevention, HIV prevention. And here, we looked at structural drivers of the epidemic. We looked at HIV in key and priority populations, and the different social, behavioral, gender issues, and other aspects that affect HIV infections, new HIV infections, and how we manage that. The papers also looked at advances in HIV prevention. It gave key recommendations based on the findings that had been shared, and very key among those was a call on stakeholders, including government and implementing partners, for us to follow up and address the gaps that have been identified in this area, and also ensure that we are applying our interventions to inform policy development as we move forward with our national programming. We had track 2 that focused on basic science, care, and treatment, and a lot of the presentations there looked at retention. How do we retain patients, clients on HIV treatment? How do we ensure that there is appropriate adherence and in care, and also for comorbidities? And as you know, previously we've talked a lot about adherence here, and I think I should really acknowledge Supercharger, who has even presented us with drama and music around that, the area of adherence and retention. So there was a lot of presentation in that area. It also looked at treatment options and HIV drug resistance, and what needs to be done for us to curb this. Track 3 focused on social support, human rights, and gender. And here we focused on HIV and gender, aspects of sexual and reproductive health rights. There were presentations made around stigma and discrimination, issues of social and economic empowerment for us to mitigate against the impact of stigma and discrimination. Key recommendations here focused on the need for us to put more efforts on sensitizing learners and teachers, and addressing issues of stockouts, especially on drugs for management of sexually transmitted infections among sex workers, and also aspects of how we should engage communities more using religious and cultural institutions that we know as a powerful medium for community engagement and influencing behaviors. The 4th track focused on system strengthening and strategic information. And here papers were presented on sustainability of financing for the national response. We received papers around human resource, supply chain management. There were papers presented on monitoring and evaluation of the national HIV response. And of course, as we all know, if we are not able to monitor and report what we are doing, then we have not done it. So M&E, very key component. Some papers were presented around this. We got feedback that the plenary presentations focused more on care and treatment, Chair, and that we didn't give enough attention on financing in the plenary, so we think that's a lesson learned for the future. But also it was noted that we had very few abstracts on financing and sustainability, and yet, as we all know, that's a very key component of our national response. So what went well as I come towards the conclusion? When a quick evaluation was done, we acknowledged that session chairs, presenters, and rapporteurs were all readily available for the respective sessions. Let's give them a hand clap, please. Thank you, thank you. It was also noted that the papers were very rich, very informative, loaded with science, and the sessions provided an opportunity for interaction amongst the delegates, which was very much acknowledged. The internet and sound system were very good yesterday, and it enabled online participants to follow seamlessly. Let's give a hand clap to our IT team, please. They're doing a good job. And then, of course, we were proud to have reached a record high of 500 participants online, and which we thought was very good engagement of those that especially were not able to join us here. Sorry, a bit of challenges. Of course, let's start, and Chair, this morning we have suffered the same trend, unfortunately, but yes, so for the future we'll make sure we address that. But also a number of online participants missed out because we reached our capacity of 500, so we were given that feedback that we may need to address that for the future. And of course, low turn up at the exhibition stalls. Chair, please note that delegates are being encouraged to visit the stalls just down the stairs, visit and look at the innovations that are being displayed by stakeholders that are helping us to achieve our targets in the response to HIV and AIDS. Lastly, recommendations. We've already tackled number 1. We've had break tea. We agreed that we should start with that to save time. Then it was recommended that we do an online survey and opinion poll where we should be able to identify what went well and what should be improved. So delegates, when this survey, when you're directed on how to give feedback, kindly participate so that we improve on the future arrangements. Also, there's a recommendation that we should look at widening capacity for online participants so that we get more than the 500 limits that we had yesterday. I thank you very much.
Thank you very much, Enid. Let's give another round of applause. I want to take this opportunity to make observations and recognition. Members of the board of Uganda AIDS Commission, please can you stand up for recognition? The team that I serve with on Uganda AIDS Commission. We are also privileged to have one of the sons of Fira Lutaya. He could stand up for recognition. The AIDS movement partners, the UN fraternity, the representatives of self-coordinating entities, the media fraternity, distinguished delegates, ladies and gentlemen. I would like also to let you know that the advance team for His Majesty King of Toro, Dr. Oyo Nyimba Kabamba Iguru Rukidi the fourth, is already with us. The advance team is already with us. We should be expecting His Majesty the King of Toro anytime now. As we proceed, we have a statement by younger people living with HIV/AIDS that will be given by Koraish Mubiru. Please, Mubiru, come forward. You have 10 minutes. Thank you.
Thank you very much, Chair of the USC Board and also the session chair. I would request that you allow me remove my mask, not because I've been fully vaccinated, but also because I want people to see how I looked before the strike of COVID-19. The Minister of Presidents, in absentia, His Majesty the King of Toro, also in absentia, the AIDS development partners in the room, the Chair, Uganda AIDS Commission, the Director General of Uganda AIDS Commission, representatives of persons living with HIV, the representative of the Phili Lutaya family, distinguished delegates, both present here and online, representatives of the civil society, the media fraternity, fellow Ugandans, ladies and gentlemen. My name is Kraish Mubiru. I work with and for the Uganda Young Positives as the Executive Director. The Uganda Young Positives is an entity that coordinates and mobilizes young people living with HIV, mainly those from the informal sector, to scale up prevention, care, and support services. I'm also privileged to be representing persons living with HIV on the country coordinating mechanism for the Global Fund here in Uganda. In another portfolio, I'm also chairing the Men Engaged Network in Uganda. It's a network of over 60 CSOs that come together to champion the cause of working with men and boys to promote gender equality, but also to fight epidemics like HIV and sexual reproductive health challenges like early child marriage and teenage pregnancy, and the epidemic of gender-based violence. This morning, I'm privileged to be presenting the voice of young people living with HIV at this year's joint annual AIDS review meeting, which is also doubling with the Fide Lutaya Memorial Lecture, termed as the National HIV Scientific Meeting. This year's HIV Scientific Meeting reminds us of the year 2016, where a gap was realized in adolescent health programming, considering that many young people were not suppressing at the time. An adolescent HIV assessment was done to see how this can be addressed. The first and vivid gap was that the HMIS, which is our health management information system, the tool did not have a demographic for adolescents and young people at that time. This led to a multitude of research to get data that would link us to the adolescents and young people. And over time, ladies and gentlemen, fellow Ugandans, there has been a crop of a multitude of organizing and organizations aspiring for ending AIDS by 2030 with this particular subpopulation. Diversification of grant interventions and increased advocacy for young people living with HIV has been done. And as young people living with HIV, our appreciation goes out to the government of Uganda and the different stakeholders who have continually been holding the mantle to end AIDS as a public health threat in this country. We appreciate the development of the differentiated service delivery model. This has been very helpful to us. We also appreciate the constant supply of ARVs, except in a few places, and also in the recent past, our colleagues have been complaining of the absence of one of the regiments known as Lotregravir. Lotregravir is a third-line option of ARVs, and in the recent past, colleagues, we've been complaining about the same. But thanks to our duty bearers, just a few days from now, this regiment will be in country. The Director General assured us a few days ago that the government has taken all the necessary measures to make sure that the shipment of this regiment comes on board, probably by end of this month. As young people living with HIV, we also appreciate and we want our appreciation to go out to the government and the different stakeholders that have enabled the separation of adolescents and key populations clinics from the general ART clinics. This has helped us to achieve services that we desire in a timely and responsible manner. However, more efforts should be geared towards psychosocial support, as it is an area that has slowly been deteriorating over the years. We also want to promote the fight against stigma and discrimination, but most importantly, inequalities amongst young people living with HIV. With the test and treat, we believe as a community of young people living with HIV that there is much needed effort for adolescents and young people. Why? Because we get limited time to first of all accept our status before being initiated on treatment, and before we know it, we struggle with retention and viral load suppression. We believe if this is addressed, there will be improved retention rates and ART outcomes. In our programming as young people, we have also seen a number of interrelationships between the building blocks of our health system versus our lives as young people living with HIV. Most of these building blocks, ladies and gentlemen, we believe and accept that are suboptimal in our country, and studies have found that the health system of Uganda would benefit from significant strengthening in order to improve the key and poor and stagnating health indicators. I'll just mention one of them, which is health financing. We all believe that most of our funding for health in this country comes from development partnerships and also foreign aid, like the Global Fund, PEPFAR, just to mention but a few. However, we have some strength and opportunity in the country's health system. Number one, we have the high-level government support for a comprehensive health system reform. We also have an engaged community of health development partners. We also have, if not the best, one of the best national health policy that includes interventions designed to address key health gaps. We also have the existence of a solid health sector. These are opportunities that we can leverage on to improve our own. In our field of engagement as young people living with HIV, we have also found a number of cross-cutting issues that we believe are priority areas to strengthen our system, but also to strengthen the services that this nation is offering to us. Number one, the system does not go further to respond more deliberately to the majority of Ugandans who are adolescents and young people living in rural poverty and semi-urban informal sector. There is also inadequacy of health financing in Uganda, and as young people living with HIV, we are not spared. The overall quality of our public health services is still low, and as young people, we remain a key and affected group of this low quality of services. Ladies and gentlemen, I also want to raise a fact that we've ignored over the years. The fact is that a third of our health service providers have got dual or multiple practices as a result of our large dynamic private health sector, which constrains the time of interaction between the patients, especially us young people living with HIV, and our service providers. As part of our recommendation in this year's JAR and the FIDE Memorial Lecture, this is what we think we can do in order to improve the situation as it is currently. Number one, if my country creates an enabling environment to strengthen the performance of our health sector, that will be great. Number two, we also recommend that we fully implement the Abuja Declaration of Health Financing to the fullest. Colleagues, I want to remind you that the Abuja Declaration, on which we committed ourselves as a country, only requires 15% of our national budget. So if we fully implement it, we can turn things around in this country. We also recommend as young people that there should be deliberate increases in funding to health, especially HIV units and community health initiatives. We also recommend that our country and stakeholders provide accountability for human resources for health service delivery at both national and subnational and policy level. We also strongly recommend that we should collectively stand up to address issues of stigma, discrimination, and inequalities in public and private non-for-profit facilities through supporting entities like those of young people living with HIV and the general community of people living with HIV. We believe that if we do this, then we'll be standing in the footsteps of our legend whom we are celebrating today and whom we are recognizing, the one and only Phili Bongole Lutaya. Colleagues, as I wind up, I want to acknowledge the Uganda AIDS Commission for giving us this opportunity to air out our voice in this space, but I also want to acknowledge our development partners who have not tired from supporting us over the years to reach the vulnerable communities of young people living with HIV in this country. As I conclude, I want to end my submission with something that I've copied from the fountain of honor of this country, His Excellency General Yoweri Kaguta Museveni. In most of his submissions, he rarely ends without quoting a word or two from the Bible. And I also want to quote the Bible this morning to remind us that the book of Psalms, chapter 37, verses 4, tells us to delight ourselves in the Lord, and He will give us the desires of our hearts. I also want to call upon each and every one of us here today, those online, fellow Ugandans, and the world at large, to delight ourselves in the young people, and this youthful generation will give us the desires of our hearts, including but not limited to ending AIDS as a public health threat by 2030. Thank you very much.
Thank you very much, Mobiru. Let's give him another round of applause for the statement we received from the young people. We shall have an interlude, and the supercharger, please come forward. As he comes, I would like to recognize Dr. Ruth Leibon Masha, Chief Executive Officer, National AIDS Control Council of Kenya. She's already online, but let's have an interlude.
Okay. Stigmaless. Good. One, two. One, two. Okay. We've been asked to give you an interview. Give you an interlude as we wait for the chief guest. The song we want to give you is called Adherence is the Key to Success. Simple mathematics. We want those people to see. Okay. Adherence is the key to success. Take your drugs and victory will be yours. HIV is a loser winner. I take my mates, that's why I'm looking super. Eh? That's why I'm looking cool. Don't put in super. That's why I'm looking good. Okay. Give us the song. It's a 2030 song. Kende zako katono bana bayivu awabala. Laba manyi kepeke. Tugende.
Adherence is the key to success. Take your meds and victory will be yours. HIV is a loser winner. I take my best, that's why I'm looking good.
Songa mbele,
Uganda,
songa mbele mbele nze, songa mbele,
Fetuliko,
songa mbele, songa mbele,
Uganda,
songa mbele mbele nze, songa mbele,
Fetuliko,
songa mbele. Hey,
Empty city is for you, my mother,
PMT City.
to produce a good and healthy child. I use a condom when I'm having sex to protect
Uchali
my
mwana mzuri.
life and protect other people's lives.
Songa mbele.
Adherence is the key to success.
Hey,
Take your meds
Legera musawo.
and victory will be
Sega abasawo bonna bali bwe bati.
HIV is a loser winner. I take my best, that's why I'm looking good.
Songa mbele,
Uganda,
songa mbele mbele nze, songa mbele. Hey,
Fetuliko,
songa mbele. Hey, songa mbele,
Uganda,
songa mbele mbele nze, songa mbele. Hey,
Fetuliko.
songa Vanessa,
Early treatment is the key to success.
early treatment.
Better test your blood and get to know your life. Positive living is the key to success. Better take your meds and victory will be yours. Songa mbele. Adherence is the key to success. Take your meds and victory will be yours. HIV is a loser winner. I take my meds, that's why I'm looking good.
Songa mbele,
Uganda,
songa mbele mbele nze, songa mbele, songa mbele, songa mbele,
Uganda,
songa mbele mbele nze, songa mbele, songa mbele.
Adherence is the key to success. Take your meds and victory will be yours. HIV is a loser winner. I take my meds, that's why I'm looking good.
Ogusembayo, songa mbele,
Uganda,
songa mbele mbele nze, songa mbele, songa mbele, songa mbele,
Uganda,
songa mbele mbele nze, songa mbele, songa mbele. Adherence. Mukawulide is the key to success. No excuses. Akasemba ke twagala kuba bakaita optimistic. It's a freestyle song. Kana bwe tukakola tetugoberera mateeka. You just feel free, do what you want to do. It's a song to do with HIV cure. I know one of the biggest questions being asked by all people living with HIV all over the world, the 37 million people living with HIV all over the world, is when the cure coming. We shall bring the
Can
song.
we all please stand up and welcome His Majesty King of Toro, Dr. Oyo Nyimba Kabangba Iguru Lukidi IV. You're most welcome, Your Excellency. Your Majesty.
tuilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Mukama waitu agutambe kale ya toro kalamalo mukuma mfuzi angirizo mwebingwa omukama waitu mulungi Memanzi ya toro Karamalo mukoma mfuzi Angirizo mwebingwa Okurema kwawe kurungi Abanaku obakwatira
We are graced by the presence of His Majesty King of Toro, Dr. Oyo Nyimba Kabamba Iguru Lukindi IV. Let's give him another round of applause and appreciation that he was able to join us today. Can we now have a statement from the community perspectives in the national HIV response by Ms. Dorothy Namutamba?
For your presentation.
Okay. Your Majesty, the King of Toro, all dignitaries in your respective capacities, all invited guests on this great day, all protocol observed, ladies and gentlemen. My name is Dorothy Namutamba, and I'm from the International Community of Women Living with HIV, Eastern Africa. I want, first and foremost, to thank Uganda AIDS Commission for giving us the opportunity to be here, but also all organizers of these 3 days for recognizing the voices of the communities in the response, the HIV response, but also the contributions that AIDS by 2030. I'm going to give you a presentation which is really around the community perspective in the national HIV/AIDS response in Uganda. And this is these are not my words, these are not words of ICW Eastern Africa, but they are the words and they are the communities that are speaking in this presentation. I'll go straight to share with you who we are as ICW Eastern Africa. And I want to say that we are a regional advocacy and membership-based organization, a network of women living with HIV that brings together women, but also young women living with HIV in their diversities. And ICWEA, we exist to give the visibility of women living with HIV on their priorities and their needs. And our advocacy is really based on our daily lived experiences, but we also use participatory approaches to ensure that we are advocating around the issues that have evidence. And in our vision, we exist to ensure that we have a holistic health and rights for women and girls living with HIV in their diversity, where we thrive and live dignified lives. And in our mission, quite related to our vision, is that the holistic health and rights for women living with HIV is only achieved through meaningful involvement, capacity building, strategic partnership, and advocacy. And we are also here sharing the voices of the women, the voices of the communities where we are coming from, that we are only being able to do so because of the partnerships that we have together as a consortium, with working in a consortium of 3 organizations, ICWEA, Uganet as our lead partner, and HIRAF. And we are supported by TASO as a principal recipient through the Global Fund to do what we are able to do in able to address the barriers in access to the needed services, TB, HIV, and malaria services in the, that are available in our country. And when you're talking about reducing the barriers, what is it that we are focusing on? That in our work, the journey starts right from the fact that we do not come at the national level to air out what we have found only at the national level, but the resources that we have been able to get through the Global Fund and through our consortium that we've been able to go back to the communities and that we are carrying out community sensitizations. We are carrying out community scorecards, which is a platform which gives us evidence. That we are also carrying out community empowerments in the different aspects, including advocacy. Looking at what are the issues. When we're saying that we have fought stigma and discrimination, we know very well that these are things that are coming up back and they're getting us very far away from where we have been. That we are also able to support coordination meetings in the districts, in the 21 districts where we are working. And that through all this work that we are doing, that we are able to dialogue right from the districts. We are able to dialogue with the communities in all their diversities. And what we come out from at the regional level, we have been able to put it at the national level. That communities are speaking. That when we are here talking about in the JAR and in the scientific conference, that the communities would have really been loved to be here. And some of them are already online, supported to be online, those who can afford to have those phones that can accommodate the virtual access. But that the fact that we bring the voices at the national level, that they are not left at the district or maybe at the community level, that as we are speaking in these 3 days, that we believe that the communities are engaging and that at the end of this, we will also be held accountable and that we must be part and parcel of implementing the AIDS memoir, the undertakings that are going to be in the AIDS memoir. And that we will also report, maybe next year, what we have been able to achieve as communities. As I said that I'm going to present you what the communities are saying, I want to allude to the fact that this annual civil society briefing, we held a meeting with over 53 communities, representatives from over 21 districts, but also at national level. We allude to the fact that as much as we have achieved a lot in 3 decades in the fight against HIV, and that right now, even as a country, we are saying that we have achieved our targets of 1990, and that we are even talking about getting now to the 95-95. HIV and AIDS still remain really a major public health threat in our country. And that the drivers are none other than the ones that you know, the increasing gender-based violence, that right now, even when we speak about the women and the young women, that Supercharger always alludes to the 6,000 adolescent girls and young women who are getting pregnant, and those many who may not even be able to go back to school. That the stigma and discrimination is also on its highest, especially even for the key population. That limited access to the HIV prevention services still exist in our countries. Care and treatment services are coupled with the poor adherence. We have been hearing about retention. Retention has been the song of this conference, and we feel that really this is not what we should be 30 years down the road. But this calls for more deliberate and impactful strategies which will ensure that the different stakeholders effectively play their role and that we all fight HIV/AIDS in a concerted effort. And I want to share with you that this is the annual civil society briefing meeting that we had. And here we brought 53 participants, which were represented by people from the districts, over 21 districts, but also it targeted other civil societies, networks, groups at national level. And we are deliberating that as we are preparing for the JAR, as we are preparing for the scientific conference, what is it that we have contributed, or where do we want to go in terms of the national strategy, the national HIV/AIDS strategy that we have, the 5-year strategy. And we shared specific issues that we felt that in the HIV response, we need to, if we continue having them, definitely, they need to be addressed, otherwise we shall go back to where we're coming from. and we shall not be able to achieve the end of AIDS by 2030. So I'm going to share with you, that's a picture of the people who came in our meeting, and that these are their voices. Some of the key issues really lie around the structural and policy barriers that exist, and that definitely we look at issues of increasing stigma and discrimination, and that not only happening by our own, but also by our own family members. When you look at stigma and discrimination that happens at schools, you wonder where we've been and where we are going. That criminalization of people living with HIV, key population, the sex workers, they leave the individuals open to stigma and discrimination. That the key population linkages still are a challenge in some districts, that sometimes you find that in some districts the drop-in centers do not exist, and where they do, they have been left to VHTs who do not also know how to coordinate, and they come in with other challenges, including the negative attitudes towards the key populations. And yet we know that our incidences and our epidemic is going towards the key population, but also the marginalized and the vulnerable population. And when they related to access to and also retention to art, we also realize that definitely right now antiretroviral therapy is available, that we really cry when we know that our own, like Philly Lutaya, struggled, massages, and also even access, maybe even the little that was available, and that was Septrin was not even then available. But now that we have antiretroviral therapy, through the different funding that we have, through our own government, the Global Fund and the PEPFAR, that we are experiencing the poor retention in care, and that the viral load suppression is a challenge for us as people living with HIV, for our young people, and that even right now when we're speaking, we are experiencing stock out of the third line. So if you get a stock out of the third line, as a person living with HIV, where do you go? What next? So you look at death as your next step. But thank God that it is being resolved in 1 month, or maybe at the end of the month, but then what were the alternatives? That we have programs that are speaking around test and treat policy, that they have been noted in one way or the other, that yes, they are also part of the problem, that people who are being enrolled on treatment, they are not given adequate counseling and support, that they may even be able to stay longer. What we did in the beginning, when we were being initiated on treatment, we were able to be supported to start treatment and to continue with it. That issues around nutritional support are still a challenge. More experienced even during the COVID times, that we are seeing that people living with HIV had to leave treatment because they did not have even anything to eat at that time. EMTCT, mother-child transmission. It is sad that in this era and time, we are continuing to see our babies born with HIV. And it has even been worsened by the COVID-19. And that mothers have been advised to adhere to treatment. But really, in the COVID-19 epidemic where we had the lockdowns, there was lack of transportation and the resources to attend to the antenatal care for pregnant women. And that there's also fear of violence, the stigma and discrimination that comes with it, the lack of preparation, the abuses that come for a pregnant woman really puts us back. And we always look at the results and not the people. What is it that they are experiencing? How can we tackle it differently? And there are instances of mothers, of course, who are not able to continue taking the ARVs or even give the ARVs to their children, really because there was absence of the enablers. And the mainstreaming of the COVID-19 in the HIV response, I can't allude to this more, because it has really, COVID-19 has affected the HIV interventions. And that it is really a key issue as we get into these 3 days and we end them with this Philly Lutaya Day, that mainstreaming COVID-19 interventions into the CSO work, but also in our interventions as a country, must be prioritized. Otherwise, we continue seeing that definitely as people living with HIV, we have that immunity which has been weakened. We are more susceptible to moving down to progression when we get COVID-19, to severe disease, to critical stages of the disease, and also death. But if they are not being mainstreaming this into the general response, then definitely we are missing a point. The community system strengthening, we know very well that we do have strategies that have been working and that are very, very good. For example, the DSMD approaches, and these are the differentiated service delivery models that are very critical in ensuring treatment adherence to improve retention and care. However, in some districts in our country, they're not well coordinated. Attention is given always to the ART, forgetting ART access, forgetting that people come for this, especially when they do also have other issues. Treatment literacy, when we are changing from other regimens to the DTG, that is a great drug, that is the wonder drug. Integration should go beyond talking and having concepts written together, but that we should also go down to having follow-ups and support for more TB patients in the communities. The gene expert machines that really exist, that find TB easier, in some districts they are not functional. They do not have cartridges. How do we want to ensure that we are ending HIV when we are not addressing the critical diseases? The civil society, the networks of people living with HIV had a call to action. And they were saying that we need to strengthen, and us as civil society and networks of people living with HIV and KPs, that we should start with ourselves and strengthen the documentation of whatever we are doing, so that at the end of the day, we are also able to show what we've been able to achieve. But also strengthen the coordination and collaboration among us as the community, but that always, when we're talking about the DACs, maybe they have now been rejuvenated, but the voices of the communities are always missing, that these need to be strengthened. And that even as we are implementing, we need to be implementing whatever is coming out from this AIDS memoir. And for the Ministry of Health, we are calling you to action that we need to provide the refresher trainings to the health workers where they have been changed, where they have brought in new ones. Definitely they need to get on board and need to address the different categories of people in all their diversities. And that they need to prioritize the provision of treatment enablers for HIV clients, but also for those who are living with, who are also affected by TB. Definitely, treatment enablers was felt by people. Even in this time of COVID, it is still a big issue. And we need to invest in the psychosocial support for people living with HIV. Where we started, where it worked best, how did we suppress, how did we better? So without the psychosocial support, we are calling out to you, our government, our Ministry of Health, that please invest in psychosocial support and also making sure that people are able to take and continue with their medication. And for our partners and funding agencies, we are saying, the communities are saying, that we should ensure that there is adequate budget for community system strengthening. That most times we're looking at us as communities, but we know what to do and we know where to do it and how to do it. That you cannot definitely say that we are only recipients of care. And I know that efforts have been done, that when the resources are coming in, but probably needs to get down to, even down to the communities. And investing in events like the JA, they give us the scientific AIDS conferences. And right now at the Lutaya Day, it's really a very good initiative. And we want to applaud Uganda AIDS Commission for taking up this initiative. And we are happy that even when during these times when we are saying that the COVID-19 stopped some of the communities to come, that we are having voices of the communities here. But we should intentionally bring communities to these forums to hear, but also to learn and take home. This is a picture of our members who were in that meeting still. And I just want to acknowledge the role of the government of Uganda in ensuring that we do exist, but also the work that we have been able to do in the communities, right from the district level, that we've been really supported, and that by the local governments and the Ministry of Health. The people living with HIV, the KP networks and groups at district but also at national level, the AIDS development partners, Global Fund, TASO, Uganet, we do appreciate, but also Uganda Commission for giving us this space, and all the partners and the stakeholders. And we're saying that nothing for us without us, and I want to thank you for listening. And as I wind up, I want to say that we also want to acknowledge Uganda's Commission for recognizing that on this Philip Lutaya Day Memorial Lecture, you are continuing a journey of awarding people who have lived a journey, the Philip Lutaya journey. That maybe the process is just starting, but probably it will be an annual event, an annual campaign that we believe will give us the milestones that we need to have. I thank you very much for listening to me.
Let's give her another round of applause. Your Majesty, we've received statements from the UN Resident Coordinator who was online. We received statements from young people living HIV by Muviru, Courage. We've now just received a community perspective in the national HIV response by Ms. Dorothy Namatamba. Allow me to inform you, Your Majesty, that we are now going to receive a keynote address on regional perspectives on HIV and COVID-19. This will be given by none other than Dr. Ruth Lebon Masha, the Chief Executive Officer, National AIDS Control Council of Kenya, just like Uganda AIDS Commission. But she will be online. She's actually online, and I would like to request that she can start her keynote address. Dr. Ruth Lebon Masha, you're most welcome.
Thank you very much, Your Excellency, and also the Uganda AIDS Commission for giving me this opportunity to share with you this morning. I would like to take this opportunity to congratulate you for hosting such a beautiful event. We've been following you from Nairobi, and we can see that indeed it is an experience that we also would like to learn from. Your Excellency, today I would like to share with you, we would like to put on the video so that you can see us. Are you able to see me?
Not yet, we can't see you. The camera is giving us the roof.
The roof, sorry. And now, are you able to see me?
Yes, you're okay. Clear on the screen.
Thank you very much. The NAC Director, Your Excellency, invited me today to make a presentation and share the experience from Kenya on COVID-19 in the times of HIV, basically a discussion around when we have two colliding pandemics. I would like to say that I would like to just begin by sharing a little bit of statistics about Kenya. Let me start by giving you a snapshot of our epidemic. Are you able to see the screen?
Yes, we can see the screen.
Okay, thank you very much. So I was just talking about, yes, in the context of the two pandemics, and I think before I even go to the Kenyan epidemic, let me just start by sharing some of the early on experiences that brings COVID-19 to be closer to HIV. At the beginning of COVID-19, we did see a lot of fear. We were also scared. We closed ourselves in our houses. Then, of course, for those who had COVID-19 at the initial phases, we found most community stigmatized, those who were diagnosed early. And then, of course, we witnessed death, and this was also very, very scary. But in the end, within a very short time, unlike the HIV response, then we witnessed a vaccine. So we've got a few lessons that we have learned, especially looking at what has happened in the trajectory of COVID-19, that although we are learned from the HIV response, now we can also learn from COVID-19. Number one is that when a pandemic like this one that has come as big as COVID-19 happens across the world, then it begins to set a different organization of the global health. So what we are witnessing today is what we did witness with the vaccines, what we did witness when the period of antiretroviral drugs, when they became available. And we have already begun to see the differences between the global south and global north. We in the global south were not able to quickly move fast enough to even buy the shares of the promising vaccines that were being put on the table. We did notice a few of the countries that did that. I think Lesotho was one of them. Rwanda, they did benefit quite early on the vaccines. And there are lessons that have been learned there, especially in the hope that we do get a HIV vaccine. We do learn the lesson about the sourcing of those vaccines. We are also learning lessons that as a community, we probably are not even prepared to have those vaccines because we do not have adequate platforms for providing adequate information to the communities to access vaccine. So those are some of the lessons. Another lesson we are learning slowly with COVID-19, as more people start vaccinating, we are beginning to see inequalities, and we'll see in one of the slides, but in terms of geographical location, but also population accessing the vaccine. So allow me just to share a little bit about our HIV epidemic. We do hope, like many other countries in Africa, that we're going to end AIDS as a public health threat by 2030. And one of the areas that we are trying to do is the paradigm shift towards prevention, realizing that when you have a growing cohort of young people, Kenya has about 42% of adult infections coming from the ages of 15 to 24 years old. And at the same time, we have new infections from children being born with HIV. You can see 5,200 children were born with HIV last year. And this begins to become problematic. In terms of burden, we still have close to 1.5 million, just under 1.49 million people living with HIV. And with new infections not reduced significantly, we begin to see that the trajectory towards 2030 becomes quite one that we must rethink. Now, since 13th of March 2020, we have had a total of 54,309 confirmed cases. Basically, these are the cases that have been confirmed within testing for COVID-19. We also have had around 5,319 reported deaths, and the case fatality rate for COVID-19 has been 2.1. Across the country, just like HIV, we do see differentiations in terms of the town places where we have seen hotspots of COVID-19. Nairobi being the capital also has seen quite a large share. Then we have other environs of Nairobi, like a county that is just next to Kiambu County that also has had the share of COVID-19. Coastal areas, basically where we have tourism, and towards your country, Busia area, and Kisumu, which is towards the western part of Kenya, also has had quite a number of cases. In terms of female-male, just like globally, we've seen that we had around now 147,000 for men and 107 for female. So we have seen, just like I've mentioned earlier, that the attack rates are different and they're differentiated across most of the geography. And therefore, these also seem to follow a pattern that we also have HIV. And because some of these centers where we have COVID also are centers, are town centers where HIV prevalence is quite high. I think in terms of test rate per week, you can see currently what is happening. The data. Just a second, where is this slide? You can see, just like most of our countries, we have the spikes, and sometimes we get to the lower weeks. Currently, as we are speaking, we are at a low of COVID-19 attack rates, and therefore we are hoping that although we have seen what's going on in China, that this indeed is going to be a period of where we are thinking that we may probably be seeing a significant reduction of COVID-19 cases. In terms of gender, of course, we still had more males than females, and just like what you have seen across the world. And that begins to also show some of the dynamics that are happening in terms of gender. However, I think the most important thing to note is that while we see more men with COVID-19, just like HIV, the burden of care goes back to the women. I think one of the other things that I must want to talk about is what we saw in COVID-19 disruption, especially when we had lockdowns, that one of the issues that we did experience is that when we closed down, most of the businesses, especially those that are supposed to be run by women, or where women are the majority, suffered more severe in terms of closure as compared to bigger companies where most of the men are able to have bigger companies. So we have seen a lot of women and losing their smaller businesses, where we know that most women run businesses such as salons, where they also have businesses like mama mbogas selling vegetables, and those smaller businesses where we have majority of women. Again, in terms of medical providers, we have seen, sorry, I think is our screen blank on your side?
Yeah, we can hear you.
But you cannot see our screen?
No. The main screen is empty.
We are trying to fix that. Just give us a second. Okay, so while they fix the camera, I think what you're talking about, what I was talking about is the fact that in addition to the smaller businesses where we've seen the gender differentiation, I think most importantly is for us to note that even within the healthcare workers, a majority of the nurses tend to be women, and therefore it's important for us to also look at those gender differentiation, especially when we talk about the majority that of people who are exposed to COVID-19. However, of course, just like we've seen globally, the science telling us there are more men who actually do get more severe cases than women. The other, sorry, are you able to put on your camera? Nelson, are you able to enable our camera?
Can you enable the camera? Technical team? But we would request that you continue the presentation.
Yes, so I was talking about the supply chain. I was talking about then again issues of the access to health services, the disruption that I would share with you. And most importantly is the lesson we learned on the issues of commodities and access to commodities, especially HIV. Unfortunately for us, the COVID-19 period came in place when we had issues of drugs, and of course surveillance and data reporting, and the opportunity we had within the National AIDS Control Council to be engaged. So what we saw in terms of services, that we had a challenge in the testing. That's why we saw a drop, especially in the period when COVID-19 hit. We saw the drop in testing services. That is around March. We also saw another significant drop, and you can see the drop was also in line with anytime we had a lockdown, we could see a drop. Then the other one that we also did see reported significantly was sexual and gender-based violence. I know this has been something that especially the United Nations has just highlighted recently. We saw some peaks of violence cases, especially When you look at our data, in the months where we had lockdown, again, you can see a lockdown, and then we can see that the number of reported cases for sexual and gender-based violence increasing. Another element that I would want to share with you, it is one of the things that has really been disturbing, and not just in Kenya, also globally. And this is the issue of teenage pregnancy in the context of COVID-19. We did see a challenge, and one of the areas we saw was that during the lockdown, although teenage pregnancy has been an issue within the country, we saw a surge of the numbers of young children between the ages of 10 to 15 who are now being reported to be pregnant, and that has been really a key challenge. So what did we do as a country? I think one of the lessons I would want to share with us in terms of managing HIV in the context of COVID-19 was to look at continuity of services. The first thing that happened in the country is when just before COVID-19 set up, when we saw the issues globally, there was in March of 2020 a circular that was issued, and one of the things is that we did already issue multi-month drugs dispensation, and it was done so early that by the time COVID-19 set in, we did not have any of the patients having a challenge in getting their drugs. The other element that where also the council did play a big role is to identify vulnerable households. The council was requested by the Ministry of Health to support in identifying vulnerable population that needed to be mitigated against COVID-19. One other thing was that within that period of planning, there needed to be the public support for hygiene, and as a result, the council then was able to quickly identify those areas where the government would put wash basins across the country. The other areas that we did as a council, of course, is to share the HIV laboratory basis for COVID-19, which is the HIV reference laboratory infrastructure, which was used, and I know most of the African countries also did the same. And then to scale up our services through the moving from some of the things that we used to do physically, we moved a very big chunk of our activities to virtual services. And currently, the council is also now involved in communication on COVID-19 deployment. So one of the things that we have done now is to begin thinking about how does the infrastructure we have built in the HIV sector then come into play, especially during the context of now where the crisis may be over and we require to sustain the prevention of COVID-19. So what we have done is that we have now integrated the COVID-19 vaccine messages across the COVID-19 messages across the HIV platforms, and we are currently working with religious organizations to use also all the platforms that we have been using to ensure that we have been able to also play a big role in terms of education. Currently, we have a number of vaccines. We still have Sinopharm, we have Johnson & Johnson, we have Moderna, we have Pfizer, we have AstraZeneca. So we've gotten quite a number of vaccines. In fact, right now our stores are full, and the only challenge now we are facing is to call out for people to come and get vaccinated. I think we are also seeing something that probably other countries may be observing to watch. We are again beginning to see disparities in terms of vaccine, access to vaccine. And one of the challenges we are seeing is that we are beginning to see more men accessing vaccines than women. Basically, this also displays the level of education, that we have more men probably who have higher education, or we have more men in urban areas where vaccines are available. So I think we may need to watch that as within the African context to begin to see already how we make sure that we do not have broad gender dynamics as far as vaccine is concerned. We also, during the lockdown, we did see a challenge, especially for populations that are at high risk of HIV, because then they needed to identify themselves. We did see stigma increasing during that time. But one of the things that we did notice is the power of communities. We saw how the men who have sex with men, for example, the sex workers, the people who inject drugs, came together and they were able to mobilize their communities to ensure that they continue to have services. We do run opiate substitution therapy. We saw communities come together to make sure that their peers are not, again, retrogressing in terms of treatment. We are cognizant that if we do not design the COVID-19 response creatively, we then end up with one of the challenges that we've had, especially in HIV. We are beginning to see that things like masks, we begin to see the disparity in terms of what citizens are able to acquire. We already see that those who are living in poor conditions are not able to afford masks, and when they use clothes, sometimes it becomes very uncomfortable, so they remain unmasked. We are also beginning to see that this is an opportunity for us to strengthen the health system. There's a discussion going on currently on the vertical design of programs that is within the country. Are we going to continue having one disease that is so strong within the health system, while we notice that when an epidemic such as COVID-19 hit, we are not able to use the same, to have the same system across the entire health system. Oxygen issues are big, and therefore the country is looking at how do we make sure that the resources that are available are giving an impact within the sector-wide of the health sector and the health system. I think basically our message that we can say that we have learned is that the quick move that we did, especially at the beginning, where we did not wait so much for the COVID to set in, but rather prepare early enough. The communities coming on board, but also the council itself being available to provide the multi-sectoral partners on the table that were doing HIV. We had the entire community health workers being engaged and being brought together to also be trained quickly on COVID-19. So I would like to say that I think some of the lessons that I'm just sharing are lessons that we share across all African countries. And I think what is important for all of us to note is that we probably may never have the same money we had before COVID-19 set. And because of that, it's going to be very difficult for us to continue with an HIV response that has the same pace that we had before. I do believe that we now have to think about disruption quickly to end new infections in Africa, in Uganda, in Kenya. We already have come to the fact that we have seen donor transition is real. In Kenya, we know it is real. Commodities such as drugs are becoming an issue where we all now have to start buying. And so for us to sustain this response, we need to quickly move in and ensure that we are eliminating stigma. We are making sure that people who are living with HIV are identified quickly. We have seen data that transmission, of course, happens in the early days of infection. We've always known that. But then we need to look at how we build community viral load so that we can be able to eliminate the HIV. And I think the key lessons is to work on HIV as a disease we know we are going to end in our lifetime. Thank you so much, and over to you, Nelson. Your Excellency, I do appreciate the opportunity to share with you. Thank you.
Very good. Your Majesty, we've just received a presentation from Dr. Ruth in Kenya, the head of Uganda, Kenya AIDS Council, which is like Uganda AIDS Commission. She's just been online. Let's give another round of applause for that presentation. We've just received our guest of honor for the next session, who is none other than our own, the Secretary Office of the President, Mr. Haji Nus Kakande. Can we give him a round of applause? Amongst us, we have members of the board, Uganda AIDS Commission, AIDS Development Partners, the UN Fraternity, representatives of self-coordinating entities, the media fraternity, distinguished delegates, those physically present here, but we have over 500 online who are watching this session. I would like now to, at this juncture, to invite Nelson to make a quick presentation before we invite the Majesty.
The Omukama of Toro, His Majesty Dr. Oyo Nyimba Kawamba Iguru Rukidi IV, the Secretary Office of the President, representing the Minister for Presidency, the Chairman Uganda AIDS Commission, the Board, the Cabinet from the Toro Kingdom, the Minister of Foreign Affairs and the Minister for Health, AIDS Development Partners, the family of Firebongole Lutaya. We have Tezra online from Sweden. She wasn't able to be here, but we have Richard, who is with us in the audience. All of you, ladies and gentlemen, Your Majesty, you're most welcome. We'd like to thank you for prioritizing this event, fight stigma and discrimination. I know you've traveled all the way from the kingdom to come and be with us here. So thank you so much for coming. Your Majesty, over the last 2 days, today is the third day, we've had very, very rich engagements. We had our partners, most of them online, but also we have a number of them in the room here. You're just about to address them. We have no time for you to know them individually. But in this room are some of those Ugandans, the heroes and our partners, the AIDS development partners who have stood with us and helped us fight the epidemic up to the point where we are now. We have activists in the room. We have musicians, we have representatives of people living with HIV, we have AIDS development partners, we have people from academia. The universities, you know, brought in very rich research over the last 2 days, and we'd like to thank you for that. We've made a lot of progress as a country. We've made significant progress. You know, HIV has remarkably reduced. From the program data, we are looking at 5.4% HIV prevalence from the national average of 6.2. We are waiting for Ministry of Health to finalize a population-based survey. We do not think it will be very far from, you know, the data we are seeing from the program. So that's a good sign. Thanks to the President, to yourself, and other stakeholders, the efforts that you've put in is showing results. But Your Majesty, it is not yet time to celebrate, because we are still seeing, as you heard one of the community representatives, we are still seeing population groups with worryingly high level of new infections. The young people, 15 to 25, we see infections very high, especially the new infections. Among the females compared to males, we see them with 3 times the infections compared to their male counterparts. The disadvantaged groups, the hidden populations, they have spoken about some of them. We see infections much, much higher than in the general population. And that's why when, you know, individuals like yourself, having the platforms that you do, when you come out and accept to lead this, we are very happy and we are privileged and proud. When I visited the palace a few weeks back, I was telling you that you're not just the king of the people of Toro, that many of us are looking to you, the rest of Uganda, beyond just the Toro Kingdom and the rest of the African continent. Because I also know that the UN AIDS ambassador against AIDS for the young people on the African continent. So we acknowledge and appreciate your work, and we are very pleased to have you here. Your Majesty, while we were going on, the Secretary Office of the President walked in. We'd like to adjust the program a little, since, you know, when you speak, it will be like crowning this segment of our program. So, with your permission, I will invite him to make some remarks. After he has made remarks, he will invite you to speak. After you've spoken, because the fight against stigma and discrimination and what Phile Lutaya started is really a momentous journey. It's something that we would like to even emphasize more to the population. We've organized one that you recognize, one of those Ugandans who have contributed to these efforts today, but there are also efforts to have awards for a number of people and institutions that will happen in 2 weeks' time. So that information will also be provided, but that is how I would request that the events move. And at this juncture, I would like to humbly request Haji Yunus Kakande, Secretary Office of the President, representing the Minister for the Presidency, to come and make his remarks. Originally, when he was coming, the Minister for Presidency should have closed the occasion, but we are adjusting this, you know, given what is available, and so that, you know, the king doesn't speak and move away without hearing from the highest office of government, that is Haji Kakande, you're welcome.
Your Highness, the Omukama of Toro, Kabamba Iguru Oyo Nyimba, the Chairperson of Uganda AIDS Commission, the Executive Director, Uganda AIDS Commission, UN Resident Coordinator, members of Parliament who are here, all development partners, representative of the East African community, the chairman and board of Uganda AIDS Commission, colleagues from ministries, departments, and agencies, all distinguished guests, both virtual and here, who are here, the media, ladies and gentlemen, including all online participants. As they have told you, my name is Haji Yunus Kakande. I'm the Permanent Secretary in the Office of the President, and I'm representing the Minister for Presidency who has been unable to come. I want to say that a good day to all of you. First and foremost, I wish to congratulate you for the successfully exhibited National HIV and AIDS Scientific Meeting that also featured the annual Joint AIDS Review and the Phile Lutaya Memorial. In absentia, I want also to thank his role as UNAIDS HIV ambassador for the youth, that's the king, in Africa, as an invaluable contribution to our national efforts to end AIDS as a public health threat in Uganda by 2030. It's indeed a privilege for me to preside over this function. As government, we relish this opportunity as it has been enabled us to appraise ourselves with the facts presented by various scientists in this conference. As alluded in my opening address, the principal focus of NRA manifesto is to improve the capacity of the state machinery in order to provide health care and other efforts in the country to end AIDS by 2030. Over years, this government has formulated a number of legislations to encourage partnerships among national and local government in the fight against HIV/AIDS. Today, we continue to strengthen this partnership, and more importantly, there is an understanding that we are building a health population for sustainable development, as strongly emphasized in the National Development Plan 3. This is extremely important because the health of the nation is measured by the extent to which government creates synergies. I believe this event facilitated constructive discussions about how each individual, family, community, and development partners, government entities, etc., can contribute to ending AIDS as a public health threat by 2030. Ladies and gentlemen, allow me to emphasize that this government has committed to work towards creation of an enabling environment of an update and health engagement on matters regarding leaving no one behind on HIV/AIDS services. We believe that through this approach, we will be able to identify those who need HIV services most and to provide quite accessible service for all. The presence and participations of members of parliament, His Majesty the Mukama of Toro, the district leaders, government, political leaders and technical leaders, religious leaders, cultural leaders, development partners, ministries, departments and agents, implementing partners, academia, the media, and artists, religious and cultural leaders, mayors and other dignitaries is very important because it clearly shows the strength of the multi-sector response to the national HIV response. Ladies and gentlemen, I wish to emphasize that we have the responsibility to protect the most vulnerable members of our society using the Constitution as the guide and other related instrument. Therefore, this conference should provide a platform to share ideas and how to respond to the needs of those most affected, including the adolescent girls, the young women, high-risk men, children, among others. We are aware of the challenges we are facing as a result of COVID-19 pandemic. The pandemic has taken a significant toll on the public healthcare sector, HIV inclusive, one major consequence being a cut in the government expenditure. However, HIV and AIDS has been identified by the government as a national priority. It is this reason that the government is intensifying the fight against HIV/AIDS by mandating all government ministries, departments and agencies, and the district local governments to mainstream HIV response in their core plans. It is important to note that our quest to end AIDS by 2030 will be in vain if you don't adopt an integrated approach. Therefore, visible leadership at all levels is needed urgently because HIV continues to threaten the social fabric of our societies. Although we have made remarkable progress towards HIV epidemic control as a country, with the new HIV infections and the AIDS-related mortality dropping substantially over the past decade, the HIV epidemic remains severe, generalized, and heterogeneous across the geographical, social, and demographic subgroups of the population. These changes call for leaders to lead with a sense of purpose and be result-oriented. Leaders must have high level of competency and be able to mobilize communities for behavioral change. The government is committed to ensuring that we deliver on good. I call upon all actors to mobilize communities to occupy the front line in the struggle to eradicate HIV/AIDS pandemic. I want to thank you for your attention. Together, we share the challenge. So, at this juncture, I would like to invite His Majesty, the Omukama of Toro, to come and address this gathering. I thank you.
the Minister for the Presidency, the UN Resident Coordinator, Honorable Members of Parliament present, representatives of AIDS development partners, Uganda AIDS Commission Board, management and staff, Director General, Uganda AIDS Commission, representatives of MDAs, representatives of cultural and religious institutions, representatives of civil society organizations, representatives of people living with HIV, the media fraternity, ladies and gentlemen. During the coronation anniversary celebrations in September, I launched the Toro Kingdom's Vision 2045, a better life and prosperity for the people and kingdom of Toro. The vision will guide the development and the transformation of Toro Kingdom for the next 25 years, with the overall goal of empowering people and communities of Toro Kingdom for a better life and prosperity. Toro Kingdom's Vision 2045 will also enable the Kingdom to contribute towards the attainment of the National Development Plan and Uganda's Vision 2040. It will also enable the Kingdom to enormously benefit from the significant infrastructure development, the improved economic growth, and the prevailing peace and security in Uganda. Toro Vision 2045 has 8 areas of focus, namely, number 1, promoting, preserving, and protecting the culture and heritage of Toro. 2, skills development for youth. 3, investing in agriculture for food security, poverty eradication, employment, and wealth creation. 4, promoting tourism as a powerful vehicle for economic growth, job creation, and improved livelihoods in Toro Kingdom. 5, climate change, environment and water conservation. 6, health for all. 7, ending HIV/AIDS by 2030. And 8, intercultural partnership for tackling the pressing challenges and achieving sustainable development. In order for the Kingdom to achieve her Vision 2045 and Uganda to achieve her Vision 2040 of a transformed Ugandan society from peasant to a modern and prosperous country, health of Ugandans is of paramount importance. Uganda, like the rest of the world, is battling the COVID-19 pandemic, but I am hopeful that we will succeed in fighting it, just like we have done with HIV and AIDS before in the past. Uganda is a success story in the fight against HIV/AIDS to the extent that many countries have replicated our multi-sectoral approach and other implementation strategies with success. Our HIV prevalence has come down greatly from 18% in the 80s to 6%, and we are one of the few countries that achieved our 90-90-90 global targets. However, there are worrying trends such as the high HIV prevalence in the new formed cities, such as Fort Portal, which has 14.3%, Mbarara 13.6%, and Masaka 11%. Another trend is the high number of babies who are HIV positive. Currently, over 5,000 babies with HIV infection, acquired it from their mothers, yet there is treatment and available at the various health facilities in the country that can prevent mother-to-child transmission of HIV. Additionally, there is HIV prevalence among adolescent girls and young women, which is almost 4 times higher than in their male counterparts. Underlying these daunting statistics in stigma and discrimination of people living with HIV, stigma and discrimination is as old as HIV and AIDS in Uganda. When the late Phil Lutaya, a young, vibrant, and popular musician from Gomba, openly came out and told the world that he had AIDS in 1984, there was no treatment then. AIDS was a death sentence. Many people with AIDS face stigma and discrimination because people were afraid of contracting the disease. Nobody would share a cup of tea or plate with someone who had AIDS, even close relatives. I like to think that this negative attitude and behavior towards people with AIDS contributed more to their death than the physical disease in their bodies. The fear of stigma and discrimination makes someone fear or delay to go for an HIV test. It makes someone fear to go for treatment at the health facility near them, and instead they opt to go to a neighboring district for antiretroviral drugs. Stigma makes someone fear to take their drugs in the presence of others. Hence, they do not adhere to their medication, yet adherence is key to viral suppression. Stigma and discrimination makes someone lose hope in life. This is the current situation that our young people are going through in Uganda. While we have made advances in developing drugs which have suppressed the HIV virus, stigma and discrimination of people living with HIV still remains. Stigmatization frequently occurs in contexts and settings not regulated by legislation, such as within families and everyday social encounters in communities, and it is fueled by many factors, including lack of understanding of the disease, misconceptions about how HIV is transmitted, the incurability of HIV and AIDS, prejudice, and fears relating to a number of socially sensitive issues. The stigma associated with HIV and AIDS tends to open discussion. Both of its causes and of appropriate response, yet visibility and openness about HIV and AIDS is a prerequisite for the successful mobilization of leaders, communities, and individuals to respond to the epidemic and the stigma associated with it. Concealment encourages denial that there is a problem and delays urgent action. It causes people living with HIV to be seen as a problem rather than as a solution to containing and managing the epidemic. Stigmatization and discriminatory actions violate the fundamental human rights to freedom from discrimination, and in addition to being a violation of human rights in itself, discrimination directed at people living with HIV or those believed to be infected by HIV leads to the violation of other human rights, such as the rights to health, dignity, privacy, equality before the law, and freedom from inhuman, degrading treatment or punishment. In terms of engaging men in HIV prevention, I openly and publicly took an HIV test and got my results. For those of you who want to know, I am gladly negative. Praise be to God. The aim of my testing publicly was to rally men in the kingdom to go for HIV testing, since it is the gateway of accessing treatment. Now, to add on to this point, the problems that we have been having in the kingdom are men going for testing. The women in the kingdom are very positive when it comes to testing. So I've been having trouble mobilizing the men. Men are a little bit more shy when it comes to testing than women. So I want to give a round of applause for those women in the kingdom who have gone out and tested. I applaud you. Men, you should follow suit. When a person with HIV is identified early, they are put on treatment early, and if they adhere to the treatment, they will achieve viral suppression, making them less likely to transmit HIV. This contributes greatly to helping our country achieve the goal of ending AIDS by 2030. Another of the areas where I have devoted my energy in the fight against HIV and AIDS is elimination of mother-to-child transmission of HIV. I want to ensure that no child in Toro Kingdom is born with HIV. As Toro Kingdom, we will promote the test and treat policy so that every pregnant mother attends antenatal care at a health facility and is tested for HIV. This will ensure that mothers who are HIV positive are enrolled on treatment, reducing the likelihood of passing on the virus to the child. Poverty is one of the root causes of HIV infection in young people, especially among girls who engage in transactional sex. The Kingdom of Toro is working with partners to ensure that majority of our youth are unemployed. The Kingdom of Toro is working with partners to ensure the majority of our youth who are unemployed are skilled. Working together, with our partners, we will mobilize the youth to achieve the economic empowerment through skilling in the areas of innovation and entrepreneurship, micro, small, and medium enterprises, the creative industry, business system development, youth cooperatives, and micro industries. This will not only enable them to become productive and contribute to the economy of Uganda, but to also avoid HIV infection. As the King of Toro and UNAIDS Goodwill Ambassador, I am championing efforts for the meaningful involvement of youth and cultural leaders in ending the HIV/AIDS epidemic by 2030. Our role as cultural leaders can therefore be emphasized. Culture is central to one's identity and sense of belonging. Our culture provides the social fabric that bonds families and communities. It is key in social cohesion and socio-economic development. Cultural leaders have a comparative advantage in dealing with social cultural norms and values that underpin the spread of HIV and HIV stigma and discrimination. In order to achieve significant behavior change in HIV prevention, the active support of cultural leaders is important in addressing changes in norms and values. Cultural leaders are highly respected and influential in their communities. People, including people living with HIV, turn to them for guidance and solutions to different challenges that they face, which places them in the best position to motivate, encourage, and assist communities to effectively tackle HIV and AIDS-related stigma. I'd also like to thank the Uganda AIDS Commission and its partners for prioritizing cultural leaders to fight HIV and AIDS. We appreciate the support you have given to the Kingdom of Toro for this cause to date. I'd like to thank the Commission for developing the national policy guidelines on HIV stigma and discrimination. The guidelines spell out the roles of various stakeholders, and we shall surely use them to fight HIV and HIV stigma and discrimination in Toro Kingdom and the country at large. I thank you all. May God bless.
Thank you very much, Your Majesty. Another round of applause for the King. Thank you for that very powerful message, for the reassurance, but also for setting an ambitious goal for us. And like I said before, it won't just be for the kingdom. Maybe we should adjust, the rest and learn from that. Your Majesty, as I requested, before you perform one last act and leave, I would like to make an announcement following on the message that you've just given. Our colleagues from civil society are organizing to see how we can further fight the issue of stigma. And we're working together with us, with Uganda AIDS Commission. They are organizing the Lutaya Awards against stigma and discrimination. They would like this to precede the World AIDS Day commemoration. We are going through the processes of selection, and after that, those who will emerge winners will be given that award. There are different categories. There is an address and a voting mechanism that will be announced and displayed to all those who would like to participate. And this is, Your Majesty, another effort to just show. They had actually requested Uganda AIDS Commission that we ask you to, if you are available, to preside at this event. But once the details are finalized, I will share with your team, and within your time, you can see how possible this is. So that is one of the efforts, Your Majesty, that is going on. But for now, this effort of fighting stigma and discrimination, Your Majesty, takes individuals like the one we are celebrating. But we have other individuals in the audience, and once these individuals step forward, there are personal decisions, there are sacrifices, there are effects that the individuals suffer, both to themselves, but also to their families, the immediate families, to their friends, to the schools where their children go. It is a difficult journey, but some of them have successfully overcome that. And that's why, symbolically, this afternoon, we are recognizing one of such heroes, even while the main ceremony comes. Your Majesty, I'll make a short citation of one of the people which Uganda AIDS Commission has selected, and would like you to bestow a recognition on him this afternoon. And this is his short biography. This man is a gentleman. He's 37 years old, and he's an executive director of a music label. And he uses this label to grow talent. He's a manager. He's schooled. It's not that he's not gone to school. He attended Namiryango Primary School for his primary level. He went to Busoga College Mwiri, went to Kitante High School and Makerere High School before graduating and going on to college. He proceeded to college. Okay. Thank you. He proceeded to college and graduated with a diploma in journalism and mass communication. He's had a media career since then. Since graduation, he's worked with media houses around the city of Kampala, the Pioneer Television, WBS TV, where he was hosting a Teens Club program. And then after that, he went on to become famous within this country, but also internationally, working with various artists. He worked with the national, he worked with NTV television for the weekend show. And currently, he works with the NBS television. A few months back, he was also introduced to another program that is known as Amasengeje. His name is Edwin Katamba, also known as MC Kat, King of the Mic. Your Majesty, Edwin Katamba is a father. He's a loving husband of his mother, and he still hosts television shows. In 2019, while during a television interview, he revealed his HIV status, sharing it with the Ugandan public, and that he had been living with the virus for 8 years. Now, since then, of course, initially he faced a lot of backlash, but he's been involved in lots of media campaigns, working with us as Uganda AIDS Commission, and a number of his products are available and online. MC Katz has worked very closely with organizations like Uganet, UNDP, TASO, the Global Fund, the Open Society Initiative for East Africa, the National Forum of People Living with HIV, Uganda TB Stop Partnership, only to mention among others. Your Majesty, it is now my privilege and honor to invite Mr. Edwin Katamba to come and receive an accolade in recognition of his work, but also to encourage other Ugandans to carry this forward. MC Katz. Thank you. Thank you very much, Your Majesty. And we are hoping this can energize the rest of us in the fight to see that there are sacrifices, but there is also recognition once you've done positive work so that others can join. Your Majesty, I'm going to request for a photo moment once we have an opportunity to have people like yourself for our archives. So I'll request you and the people at the podium, the panelists, to join you. His Majesty the King. The following will join His Majesty the King in the picture. Your Majesty, I'm told there's a live painting that has been going on, that one of the artists has been painting this occasion as you were speaking. This is very creative. It's on your right-hand side at the bottom. And they are requesting, this is part of the talent that, Ugandans are. And it will be part of the processes, and in the these are the people in the sign. Your Majesty, the following will join you after the photo op to sign on to the portrait: yourself, the Secretary Office of the President, the Chair Uganda AIDS Commission, the acting UN AIDS Country Director representing the ADPs, myself, and the representative of young people. So we will first take the picture from where the King is right now. The development partners, Dennis from PEPFAR, Gloria, young people, Supercharger, Major Ruvaramira, is he still around? Joanita Kawalia, MC Carts, of course. Just limiting the crowd because of SOPs and the space. Oh, Richard, please come. Richard Lutaya. This is it's a representation of the heroes, in the fight. It doesn't mean any of you back in the audience are not, you're doing as much. But let these colleagues represent us, Thank you. Thank you very much. So, Your Majesty, I request that
right about now, His Majesty, the King of Toro, is signing. We'll have the Chair, USC, to sign. We'll have the DG, USC, a representative, UNAIDS, a young person, representative, Secretary of the Development Partners, our award winner, MC Katz. Richard Lutaya, please also come and sign. And then after, we'll have the anthems and then closure. That is Richard Lutaya Mugaga, the son of the legend, Philly Bongole Lutaya, signing. Right about now, thank you for the applause. I think we can have more of that. We are going to have the anthems, and then we'll close this segment, but the program is still going on. Let's all stand up on our feet.
Mukama waitu, omulungi omukame manzira todo garamalo mukoba nfuzi angirizo mwebinga Mungu twaomba unilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Okay, thank you so much. Let's have a closing prayer. Father Lord, we want to thank you for this day. We want to thank you for all the delegates in this house. We want to thank you for our King, Oyo, the King of Toro, and his good work he has been doing, and everyone who is here, and his role he or she has played in the fight against HIV. We pray that you help us achieve our target of Vision 2030, and we pray you enable us to give us strength and give us the wisdom to come up with new interventions so that we can achieve our goal. As we are moving out, give us journey mercies, protect us from all the devil's plans, and let us keep together in harmony and solidarity. In Jesus' name I've prayed. Amen. Right about now, His Majesty is going to move out, but the rest of us, we are still going on. And the chair, I think I'm still with you. We are going to have a very, very interesting interlude from my band, which is the Y Plus Music Band. Are we ready for us? You can have your seats and enjoy. Where is the Y Plus Music Band? Where are you people? You better run here. DJs, are you ready? Thank you so much, everyone. Once again, my name is Nawanyaga Gloria. I am a young person born and living with HIV. I'm an HIV advocate and a human rights lawyer. I am the founder of the Y Plus Music Band. Right now we are few, but it's a big team, and we are young people living with HIV, both infected and affected, and we use our talents to create a positive change through edutainment. We are going to sing for you, or perform for you, a song called Fight HIV, and we believe this is the right time to fight HIV, and we achieve our goal of ending AIDS by 2030. DJ, are you ready? feel free to stand and dance along. Yes, because as we are in the fight and struggle, it doesn't mean that we should go back to our morning eras of, crying, HIV. No, we can, advocate, but at the same time, be grateful for. Thank you. Louder. Hey, hey. Boy, it's time. Boy, it's time. Boy, it's time to fight HIV. Boy, it's time. Boy, it's time. Boy, it's time to fight HIV. Chana kunyo chiruma andi twagate ate. Yeah. Nange sayakala okuba ganina kauka akaleta mukenenya. You can clap for us.
And support you for real. Yeah. Mira jagala yo bulungi, we yagale ya bulungi, ujabuko kabase.
Oh, it's time.
It's time, girl.
Oh, it's time.
It's time, girl.
Oh, it's time.
It's time, girl,
to fight HIV. Boy, it's time.
It's time, girl.
Boy, it's time.
It's time, girl.
It's time
to fight HIV.
Tuanale, tuagile, tukone, tulichimwe. All we need is a love and care, 'cause we want people. Yeah. Ela wambi bukume. Kona dance.
Lista. Kulo mutima.
We want people. Ojaku Angola.
Boy, it's time. It's time.
Raise your hands.
It's time. It's time.
It's time. Yeah.
To fight
HIV. Boy, it's time. Boy, it's time. Boy, it's time, yeah.
To fight
HIV. Thank you so much. It's time to fight HIV, and we are the Y Plus Music Band. We have one more song, DJ, and it's called Together for the SDGs. The SDGs are the Sustainable Development Goals. I'm glad the King, His Majesty Oyo of Toro, talked about the Sustainable Development Goals. And I believe as people in the HIV response, we fall under SDG 3, which is good health and well-being. And it's our role to advocate for all SDGs as a whole, because they all work hand in hand together. DJ?
Let's go.
Meanwhile, we can have a freestyle as DJ is also setting himself.
Okay, let's bump it. J. My name is Kabogoza Timothy, a young person living with HIV since I was born. I'm 21 years old now. I'm a musician and a professional tailor, as you see. Designs made by me, worn by me again. I'm a musician, naturally. Let's go. So I want you guys to at least clap for me once like this. Like this. Let's go. Tabana banji balina stigma, muto mukulu fenna byatutama, discrimination tebinyuma, katonda yekamatu yatukuma, mpozi n'abamu kwabo bamama naye nga bambi lwaki weekotogera, fenna tuli wano tewali yayagala, kyokka eddagala jjoba olina okulimira. Keep time, good dance kwe kuwangula, gwe mutali eyo bambi zuukuka, gwe self stigma olino jikasuka tabajirina bote baba na waka. Yeah, we're tired of this situation. We need a lot of sensitization to stop stigma and discrimination. Yeah, discrimination. Thank you. As we go.
Yes, that's wonderful. So proud of you, my brother.
Okay.
Yes, ladies and gentlemen, Reagan Techniques, my names. Reagan, my names, but I'm so-called Techniques. I looked at it this way. In each and everything that we do, we put in certain kind of techniques. As we are fighting against HIV, we are putting in certain procedures and techniques. So since the techniques comes out of us, which means we are the techniques. That's why I call myself Reagan Techniques.
Yes, techniques.
Yeah, so I'm an artist as well. I'm an actor. I'm a poet. I do quite a number of stuff. So I'm a business person as well, and a health and nutrition consultant with Rate 5, Salad Master, for those who may be knowing. I do rap music. Maybe I can give you an a cappella. He gave you a task to clap like this, but I'm going to increase the energy a little bit. I want us to increase the speed a little bit, like this. Okay. Yeah.
Can we do that?
Yeah. So we are fighting stars, so we are rising stars. Been through a lot, but in God we trust. In the blind eyes of mankind was a young, positive and creative minds, but before God we are beautiful creatures with eternal strength. One people, the power of humanity has brought us together now and forever. Brotherhood, sisterhood, standing twice as tall, living in the blood of Christ and we never fall. Through Him we are reaching the breath of life, reaching love, reaching money, reaching everything we're meant to have in this world. Then why not cooperate, meditate, celebrate and jubilate? We're here to celebrate because HIV is ending before 2030. 2030.
We also have rappers here. By the way, Reagan is not HIV positive.
He's just affected.
He's just affected, but he's so much passionate fighting HIV and AIDS. Yes. So people not living with HIV and you are HIV negative and you feel when you come and join us in the HIV response, people will presume that you're positive. Please don't have that mindset. Just come and join us because this is our fight.
They have
as
to
all
join
of
the
us.
fight.
DJ, you are ready? So we are going to perform for you, as I said earlier, a song called Together for the SDGs.
Hey mama, hey. Hey mama, hey. Why blast music band?
DJ the sound. I can't hear anything.
Together for the SDGs. Imagine how we know poverty. Imagine how we know hunger. Imagine how we good health and well-being. Hey mama, imagine how we quality education. Imagine how we gender equality. Imagine how we clean water and sanitation. Everybody has the chance and the ability to make a good difference. We can join our hands and commit to the SDGs. If we work together, let us sing together. Together we go stronger. We can do better. If we work together, let us speak together. Together we go stronger. Sustainable development
affordable and clean energy, decent work and economic growth, industry innovation and infrastructure, reduced inequalities, that's what we yearn for, sustainable cities and communities, responsible consumption and production.
Sustainable development goals.
Solutions for the planet, let's make it our target. Something we can do, all the issues on the planet. Change the world forever, change the world together. Yeah, okay, I just say we need a cappella.
If we work together, let us speak together. Together we go stronger. We can do better. If we work together, let us speak together. Together we go stronger. for life. Peace, justice, and strong institution. Partnerships for the goals and solidarity. Everybody has the chance and the ability to make a good difference. We can join our hands and commit to the STV. We can do better if we work together. Let us speak together. Together we go stronger. We can do better if we work together. Let us speak together. Together we go stronger.
Guys, can we sing that together? We can do better if we work together. Get up, speak together. Together we go stronger. Can we do that, please? We can do better if we work together. Get up, speak together. Together we go stronger. Thank you so much. Thank you guys. Clap for us. Mom. This is the Y Plus Music Band, and as the co-MC, I'll still remain on stage. DJ, next on program, we're going to have an audio from Tezra. Tezra is a daughter to the late Philip Bongole Lutaya, who is the legend we are celebrating today and remembering his service when he was still alive in the HIV response. Are we ready?
Good morning, ladies and gentlemen, Uganda AIDS Commission and all the participating partners. Thank you yet again for this opportunity to share a few words with you on this very, very important day to us as a family. The year's theme really speaks to me because stigma was one of the very, very first things that we experienced when our father came out to the world and his friends about his HIV status. Immediately after he had told his friends in the circle that we were living in Sweden, we were banned from visiting our friends, and as an 11-year-old child, this hurts quite a lot. We did not understand why our father would not let us go to visit our friends. He would explain it in a way, he tried to make it not seem too obvious that the parents did not want us to be around their children because of the fear that we might give them HIV. So the stigma has been there from the beginning, and I think 30 plus years with the progress that has been made, with all the information that we have, with all the programs, with all the outreaches, stigma should not be an issue today. And it's really, really, really very important that we send this message home so that our young brothers and sisters who are in this day and age dealing with their own stigma should not have to add the stigma that is faced out in the world. If they couple this with the stigma, the self-stigma that they have to deal with to begin with, it is a very devastating blow to the fight to end and reduce HIV/AIDS. So what I say to because as it is today, we have many of our younger brothers and sisters under 30, under 40 living with HIV. we need to give them a broader platform so that they can be the champions to drive this message home. They should be the faces. They should be seen and heard quite a bit more so that people can understand that HIV/AIDS is not old. HIV/AIDS does not belong to the 80s, 90s. No. We have our own very young, vibrant, smart, creative, very brilliant young people among us who are living with HIV, and they are productive to our society. So we should not exclude them by stigmatizing them, because we are then losing a large pool of fantastic people, because Uganda as a young nation needs each and every one of us and each and every one of the younger people in order to move forward. So, ladies and gentlemen, thank you for keeping the fight going. We need to re-energize the younger people living with HIV to make sure that they are seen, they are visible, and they are empowered to do all that they can and are able to do. Thank you very much. Godspeed and have a blessed day. This is Tesra Lutaya.
Our dear participants, oh really? Okay. Joanita, you have now heard. Thank you. Okay. Ladies and gentlemen, can we please reconvene for the closing ceremony? Kindly take your seats. And as you do, I would like to welcome the chair for the last session. I would like to welcome the chair for the last session, for our closing session, our board member, Mr. Fred Varongo. Please take your seat. We will also have Dr. Peter Wakoba, who will be presenting the aid memoir. Please come up. The chair, UNASO board, please come and take your seat.
Hello. People standing behind, please come and take your seats so that we can go on. We have not yet closed today's program, so we are kindly requesting you to first come back, take your seats for just a few minutes, and we go into the next session. A humble request, even those outside, if you can hear us, please come back and take your seats so that we can go into the next session. Thank you for those who are responding. And
What do you want?
Okay, in the meantime, allow me to recognize our exhibitors. Earlier on, we asked you to take off some time after this session to visit our exhibition, which is downstairs under the tents. And these are some of the exhibitors we have today. We have Infectious Disease Institute, IDI. Thank you for clapping. We have Friends of Canon Gideon Foundation. We have Federation of Fisheries Organization Uganda. We have Binji Herbal and Nutritional Supplements. We have the National HIV and AIDS Documentation and Information Center. And then last but not the least, we have the North Star Alliance. Right about now, we were a little bit waiting for the chair board, UNASO, but let me request the chair for this session to take over. Thank you.
Thank you, Madam MC and all the members. Good afternoon, ladies and gentlemen. I know it is a bit late, and then we might be seen as standing between you and the lunch, but I know we will be very brief as we go through this other process. We request that you bear with us just a few minutes, and then we will be outside here. I want to thank you for having participated, both the people physically and online, for the last 2.5 days. It has been an engaging exercise where we have learned a lot, but it is also good that we get to know what really has transpired. And in my local language, there is a saying which I will translate, that sometimes the hoe breaks when you're about to finish the digging here, or you're about to go home. So let's be patient and let the hoe not break now, and we have that. So I'll take the opportunity to welcome Dr. Peter Wakova to come and give us the aid memoir for us to see really for the 3 days, the 3 days, let's say, we've been here, what has come out of that. Over to you, Dr. Peter Wakova.
Thank you, Chair. Kindly allow me to remove the mask. I'm fully immunized, and I'll benefit also from those who are completely masked. Protocol observed. On behalf of my secretariat behind there, can you please wave to us? Behind there, I'm going to highlight a few things and also tell you that the process of the aid memoir compilation started some time back. You know very well we have the JAR report. It is on our website. Kindly find some time and look at it in detail. It has many recommendations, and as a way of presentation, I'm going to highlight the undertakings in the JAR report and also highlight what came out of the conference, and I'll try as much as possible not to repeat the summaries. I'll take the recommendations. You very well know that undertakings are highlights. They are key recommendations which we have to emphasize, sure that we have a dent on the epidemic. So the presentation is in 3 summarized parts, and kindly, if we have forgotten something, let us know. I would like to re-echo, I think the recommendations have a strong grounding in stigma and discrimination. Almost every statement, every presentation, whether new technologies, but the underlying thing is stigma and discrimination, in keeping with the Lutaya Day. Okay. So for details of the JAR or the Joint AIDS Review undertakings, kindly refer to Annex 3 in the main document. You can, since you are registered, kindly you can open the website. So we have, the issue is primary prevention. The first issue that is in prevention, we realize that we have problems in social behavior, communication, and change. And that's really the key intervention for the HIV and AIDS response. Remember, in the beginning, we didn't have drugs, so we survived because of ABC, and we need to strengthen this. We need to drum about behavior change. And here we are saying, can we reinvigorate this and use target-sensitive, innovative approaches? We reach out to different populations using different approaches. If it is social media, the details of this, the further breakdowns are in the document, but I'm just highlighting. The second one is the National HIV Prevention Roadmap. It details everything about HIV prevention, combining both structural, biomedical, and behavior interventions, which will help us have a dent on the, further dent on the HIV interventions. Then we have a communication strategy. This was finalized and we need to disseminate it. The way you approach dissemination of information, it varies according to the different age strata and the different groups. The way you approach a young person is not the same you'll approach like a person like me who is above 40. So that we need to have age-specific targeted dissemination, and the communication strategy details that. Some of these documents are in the tent in the Uganda AIDS Commission exhibition hall. HTS is HIV testing and HTC, that is HIV testing services. So we need to optimize these using the services which are available, and then scale up family index testing to reach out to all children of HIV, people living HIV in care or newly diagnosed. Here what it means is that if there is a family member or a child you have identified as HIV positive, of course you go backwards and find out about the family members, and once they open up and are able to be tested, you'll be able to find, because especially children are exposed. So you should be able to use that model to identify the close family members who could be having HIV and it's not is unattended to. Targeted prevention interventions for prioritized activities, those are the KPs. And what are we talking about? We need a multi-sectoral action plan and accountability framework. Our efforts are already there, and we need to have this finalized and have it implemented. So we also have what we call a MAPS priority action plan, that is most at-risk populations action plan. It's in a draft form. We need to finalize it, disseminate it, and implement the interventions therein. Then the data collection tools. We find that in most, for those of us who are in M&A and those who review reports, you find that the data for KPs, the key populations, is scattered. It's difficult to collect. So in a way, we respond by identifying those areas where we can collect the data and develop data collection specific tools for that population. Then, of course, data quality assessment, and I can assure you, if you don't have data, then you'll have nothing to talk about. And those of you who are implementing, if you don't give us data, if you don't report, then it means you have not done anything. We still have a condom programming gaps, and we're saying roll out the national comprehensive condom programming strategy and implementation. That strategy runs for 5 years in tandem with the national strategic plan. And then, of course, the issue of condom dispensers, the issues of the last mile delivery of condoms, because the people who need them are there in the community and different places, and it is a good practice to have them easily accessible, available, and if possible, cheap or free. Care and treatment, we have gaps in retention, adherence, and viral load suppression. In the 95 results that the DG presented on day one, we find that it is viral load suppression which is below 90. It's about 84, 86%. So to have this, for us to attain the 95 target, that change that we have to look at strategies to ensure that we improve this. So we complete the art regimen optimization to improve the viral suppression and transition of all children. Their children transition, they have different regimens, and as they grow up, they transition into adult regimens, and we should be able to take care of this. Then scale up young people and adolescent peer support. Sorry, the EPIs. It's called the so-called the YAPs. So this is a targeted intervention which is yielding results, and apparently it's only in 72 districts, and we need to go across all the districts and across all the age brackets. We have a toolkit, a rollout the community strategy toolkit and curriculum to improve self-care and patient literacy. You know, yes, we have the OFIA results. We can confidently speak about the last one. You find that there's big knowledge gap, and if we improve literacy, both for prevention and care and treatment, this is the way to go. There are still misinformation in the community which we need to clear. If there is misinformation in prevention, then it travels all the way into care and treatment, and this we need to address. Then there is a strategy. As you know, we are antenatal care. Previously we were implementing the focused antenatal care, where you go, they recommend 4 antenatal contacts. And you know, in HIV and AIDS prevention, PMTCT is a good entry point. Why? For you to get pregnant, you will have not used a condom. You would have, so that's a good proxy indicator, unless if you have used the IVF, and not many people can afford IVF. So we used to have the focused antenatal care, where we have recommend 4 visits, but right now the visits have increased. We want mothers to attend antenatal care at least a minimum of 8 times, and those 8 times, at every visit, there are different interventions, and with limited health workers, there is a model, and I think it has been done in Rwanda and some other countries, I think partly in Kenya, where we have group antenatal. Those enlightened mothers, those who are confident, who understand antenatal, help the others, especially the young ones, the prime gravity, to access, to understand antenatal and the interventions they are in. Some of those interventions are really, they are helping. They don't deal nothing specific, like very technical, but to help them adapt to antenatal. So, of course, viral load is the key, and we need to monitor it at every level, because if we understand that if we have viral load, then the risk of transmission among the population reduces. And we need studies on this. Probably in the next year or NAC, we shall have this well documented. Care and treatment continues. We talk about integration. We shouldn't run services which are fragmented, which are parallel. We need to integrate them. Not just with the communicable diseases, but we also have non-communicable diseases. One of the days of come back, a mother is pregnant, say, the antenatal clinic runs on Tuesday. Then once refill, the art clinic runs on Wednesday. Then as a child who's living with HIV, the children clinic runs on Friday. So the whole week somebody is moving up and down. Or blood pressure, you go to general OPD. Very distressing, and want integration both for all diseases, so that a whole complete continuum of management is there at one place. Then of course viral load. Sorry, some points are repeated for emphasis, and we have to go viral load. We have to reach more than 95% if we have to have AIDS as not as a public health problem by 2030. Social support. I will summarize this. We have drummed stigma and discrimination. The interventions are in there. We have drummed gender-based violence. The interventions are in there. We have drummed socio-economic strengthening. We need to tag on the innovations, the socio-economic interventions by government, the parish development models. Can we have organizations which can tap from this so that we move together? And we know very well that, of course, COVID complicates. I still peep in maternal child health services. I can assure you, 12, you can't believe, 12-year-olds pregnant in this period, 12, 13, 14, 15, those are children. And this could be some of the effects of COVID. Children are out of school, they don't have what to eat, they don't have what to do, and somehow they jump into risky behaviors. Gender-based violence, I've talked about. Child protection, talked about, across all the network. That is why we emphasize, that's why the response in Uganda is multi-sectoral. It's not only for the health workers like it was before 1992. We have all the ministries, departments, and agencies involved in this. Systems. We talk about leadership. We have talk about coordination at all levels, both at national and subnational levels. We need to prepare at all levels. Ministries, departments, and agencies, local governments. We have many urban centers, and with the rural urban migration, definitely we need to take care of that. We have cities, and the excitement. I come from Mbale. The change from Mbale municipality to Mbale city has caused a lot of excitation. As a medical officer, I used to work in Bufumbo at one time, but it was a rural place up there in plantations. Right now, it is part of the city. The excitation is too much. The excitement is too much that everybody will tell you, doesn't want to tell you that he comes from Bufumbo, Sabo County. I come from Mbale city. So all those are associated with other things. So integration of coordination. Why should we have a COVID coordination task force in the district, AIDS coordination committee? Why don't we integrate them so that after all, the membership is almost the same. We can have all these committees do the same thing so that we are able to optimize the little resources that we do have. Of course, financing. We talk about innovative resource mobilization, not only about money, but all the other resources involved. We can do in terms of the biggest way is to go mainstreaming with the minimal resources, the available resources, available structures. We do mainstream. You don't have to go for a different outreach to pick a blood sample, a dry sample from a child. You can do everything, provide antenatal services, do health education, but also pick samples and have them transferred, taken for viral load. And then, of course, we need to institutionalize and implement the NHASM recommendation. NHASM is National AIDS Spending Assessment. It details where is the funding coming from, how is it spent, are we able to get returns, and where should we invest so that we get maximum returns. Details of those plus accompanying documents. Okay, M&E, I can assure you, we tell you, if you don't report, if you don't monitor what you are doing, then you are not doing anything. You are doing it wrongly and probably patting yourselves on the back, yet you don't know what you are doing. So we need a lot of M&E, strategic information management, and one of the key strategies, it kills me whenever I think about it, and Jotham knows it, that the situation room pains me. I hope it comes sooner than later. And then, of course, the burden estimates. Right now, we are able to establish the burden of HIV per district. We have moved from where we would do estimates for the country and then sub-national level. We went to the regions, classified districts into, if you are from the east, then you say you are from the Oregon region, but now we can estimate up to the district level. The districts know, every district know the number of new infections, they know the AIDS-related deaths, they know which intervention to do, and that's the level at which we are, and want to scale up that. Okay, then the last one, of course, we're reviewing the new regulations, and these have a legal, they have to go through the legal systems. Okay. From our analysis, from what came from the JAR report, there are no big differences. The differences could be in the wording, or they are coming as a more detailed evidence-based. Because in the program, mainly in the JAR report, we are looking at program reports, but here we are going into research. And these are the key recommendations that come from the research. And we can marry them. We have still a lot of work to do. The previous ones, we have an action plan. If you look at Annex 3 of the report, we have everything there. In prevention, I read them the way they gave them to me, and sorry for the crowding of the slide. It says support and empower all young people, including adolescent girls and young women and key populations, to overcome the impact of COVID-19 and prevent teenage pregnancies and infections. Like I said before, for every pregnancy, there is 99.9% there is sex without protection. So for very, very few percentage, maybe we'll do IVF. Then, of course, the issue of stigma comes out here strongly, gender-based violence and other intersecting vulnerabilities that hinder young people, women, and other populations at increased of contracting HIV. I won't read word by word. And then actualize. I don't know what this means, but it's just emphasizing the fact that multi-sectoral way is the multi-sectoral response is the way to go. We cannot handle this single-handedly as Minister of Health, Minister of Gender, whatever, but we need to go multi-sectoral at all levels. Then, of course, we also have to prioritize integrated programs that promote girl-child education and skills building, empowerment as a major HIV prevention. Girl-child programming, it's good, but kindly don't also forget that, you know, issues of gender-based, we're talking about women, we are talking about girls, but we are neglecting the boy. Where you neglect him, he'll also go and cause havoc somewhere, if he's neglected especially. So we need to not to throw that away. Then invest in platforms that promote leadership development and voice for young people. Why young people? Because that's where new infections are. They are needed. They don't have what to eat. They are orphans, and we need to look at that with a very big eye. Then we decentralize all these interventions at lower levels. Let's not stay up here, but we support all the local governments, the districts, municipalities, so that we have decentralized response at all levels. Thank you. Thank you. Care and treatment, we are talking about integration. Even we could not just leave it at the GR level, but even here, all those presenters who did especially prevention and systems, they were talking about integration with the new technologies. Gone are the days when you'd go and talk about cancer of the cervix or these cancers, and you'd visualize an elderly woman, 65 years and above. Right now, the cancers are in the young people because of the lifestyle, because of HIV and AIDS, because of infection with human papillomavirus, and we need to offer them from 21 years upwards. We need to offer them testing screening services, and more so, if for those who have HIV, we do it after every 1 year, because the risk of transformation is high. So integrate, scale up viral load. This is just emphasizing the fact that we need this. Then, because of the burden of this, came from some findings that which were presented, because of the health facility burden of patients. Some patients are discharged when they are not ready for discharge. So what is that plan that we have for them? Should we discharge them to go back home and die and come back when they are worse? So can we have good guidelines, whether it involves task shifting, whether it involves home visiting, whether it involves the differentiated that model? Can we make it better and more accessible and more applicable to our health services delivery system? Then we have CPHL. There's DNA sequencing to predict viral load, resistance to the drugs. I think that's a good innovation which we need to scale up. And then I think that's it. Next is social support, high stigma. High stigma and discrimination, and then of course gender-based violence came out, and this is well addressed. We don't need to reinvent the wheel. Now, we have only 3 recommendations. We can turn them into we can call them undertakings for this meeting. One is that subsequent joint AIDS reviews, this we have to do. We have to do because it's our mandate to monitor implementation every year. So saying should focus on showcasing implementation science with a conference mode, make it more interesting. The second one is we have the national scientific meetings be institutionalized, and we ask for support and convened every 2 years as a precursor event. So which means that we shall have JA in between, then we have this one. It keeps us, and we shall have newer technologies coming in. And then we have a self-coordinating entity called RASP. It's mainly coordinated by universities who want it to support it. And then in combination, we fast track the research agenda so that we have good researches, good innovations to benchmark. Now, let me sum up the last year. I've finished. I'm done with the undertakings for the NAC and the Joint AIDS Review. And we can have them. More can come. If you think we have left something, let it come. We have not yet made the final. But from the undertakings of the last year, we achieved about 90%. There are a few areas, and we did not drop them. Some of them have come back, either in wording or direct. So these are the ones we did not achieve. Sexuality education, that one, you know the problems, and compounded with the lockdowns and the closure of schools, but we can't drop it. And I think yesterday when I left here, I was listening to something on the radio in the car, and they're emphasizing that. Implementation of the multi-sectoral action and accountability framework for elimination of HIV infection among adolescents and young people. We have dreamt this, we've come a long way. We are not going to drop it. It's something good that we should continue. We did not achieve what we wanted. Then we also had gaps in the condom programming in terms of availability, accessibility, which we need to address. And then, of course, there's this thing of patient unique identifier. We have all the registries. We have the NINs. We have passports, everything. Sometimes we say lost to follow up simply because I have maybe moved from Manafa, my home district, and I'm now in Kampala, and I'm registered as a new person without taking track of my record. Thank you, Chairperson, and I would like to stop there.
Thank you very much, Dr. Wakova and your team. Members, you can see that Dr. Wakova and his team have done a lot in collating, synthesizing, and consolidating what we have here. So they have done an excellent job. I know there could be 1 or 2, 3 things that they may have omitted. We will request that if you have any thought that you think was not included, the team behind there is there. They can still collect that information and add it there. For those who are online, we request you that you put it on the chat. We will still trace that. But I want to thank the team very much, and let's have another applause for the team. Thank you very much, Dr. Wakova. That has been great. Ladies and gentlemen, you can take your seat. Ladies and gentlemen, when we are managing such a program, even for 3 days, there are certain challenges that may come. We request that if you give us some extra time, and if maybe you are not given an opportunity to deliver your speech, please, we are human beings, anything can happen. Please forgive us. I'm told the representative from the civil society, I think, had other engagements and they could not wait until now. So we will skip that and move on to the last one. Give us a few minutes where we have the last speech, and then we can go for our lunch. Uganda AIDS Commission is guided by a board, and therefore the board that provides strategic direction, which is headed by the chairperson, who is Dr. Eddie Sefluya Mukoyo, who is with us here. He's been with us here for the last 2.5 days, or 3 days, call it now, attending to everything here. We thank you, Chairman, for being with us all throughout, and for the views and contribution that you have given, and also guiding Uganda AIDS Commission. This occasion has been your brainchild. We have settled here. It will be a pleasure for the members here to have a word, a remark from you as we end and close this function. So, Chair, please come and make your remarks, and then, yeah. Over to you, Chair.
The session chair, members of the board, Uganda AIDS Commission, aid development partners, United Nations fraternity, representative of self-coordinating entities, the media fraternity, distinguished ladies and gentlemen, both those that are present and those who are online. I'm glad to receive you all at this closing ceremony of the National HIV Scientific Meeting featuring the JA and the Fidel Lutaya Memorial Lecture. This meeting brought together researchers, policymakers, implementers, and the donor community, civil society, the media, and communities. We have come up with an aid memoir that we've just received now, detailing key issues from the discussions, recommendations, as well as undertakings for the next year of implementation of the National HIV/AIDS Strategic Plan. On behalf of the Board of Uganda AIDS Commission, I promise that we are going to closely follow up the Uganda AIDS Commission Secretariat so that the undertakings are fulfilled. The past year has seen a lot of achievements as presented in the JA report. In particular, I would like to mention again the following: development of the National HIV Research Agenda, which has been presented at this meeting and will guide national research priorities. Development of the National HIV Communication Strategy, which will be rolled out countrywide. Development of the national policy guidelines on ending HIV stigma and discrimination that were recently launched and are being rolled out countrywide. These documents were developed through highly consultative processes and will make significant contributions to the implementation of the presidential initiative on ending AIDS as a public health threat by 2030. I would once again like to thank all the stakeholders who organized this meeting, include the Coordination Committee, the Scientific Program Committee, the Research Academia, the Research Academia and Professional Associations, self-coordinating entity and institutions that they coordinate, the National Conference Technical Working Group, the JA Technical Working Group, the Presidential Fast Track Initiative Technical Working Group, the board and staff of Uganda AIDS Commission. I would also once again like to recognize financial and material support that we have received from the government and our partners, especially UNAIDS, UN Women, UNICEF, and PEPFAR. Together we share the challenge, and together we shall end AIDS. Thank you very much.
Thank you, Chairperson. Ladies and gentlemen, we need another hand clap for the chair. Big one. Thank you very much for that presentation. I want to take this opportunity to thank every member who has been attentively listening in this room and those who are online. Thank you very much for being part of the HIV/AIDS response and your ideas and views that you have contributed. It's been a pleasure being with you here. We have enjoyed that time. And their commitments that we have made, we call upon every member to ensure that we fulfill these commitments. Ladies and gentlemen, we know we were invited here by the chairperson, and I think if he doesn't dismiss us from here today, he might find us here even next year. So I want to take this honor to invite the chairperson to officially close this function. Thank you.
I would like to once again join the chair of the session to thanking and recognizing all those that contributed to making this event successful. Those online and those who were able to attend physically, we thank you so much. The organizers and the development partners that supported this process and government of Uganda, we are very grateful. We now have come to the close of the 3-day event, and I would like to officially close these sessions. Thank you very much.
Thank you.
Ladies and gentlemen, we've come to the end. Thank you very much for being with us. Lunch is being served near the swimming pool. You are most welcome, and have a good afternoon.
Children are crying from fear and hunger. Give them the peace and love they deserve.
Fide Bongole Lutaya, probably one of the most talented musicians Uganda has ever produced. Lutaya was good at many instruments, and his singing skill hit the peak in the 1980s when he was unmatched. As a young musician, Lutaya honed his skills in singing and playing instruments with the Crane Band in the 1970s. He later teamed up with musicians in Zaire, present-day Democratic Republic of Congo. In 1981, Lutaya moved to Sweden to further his music career. Exposed to the latest recording technology there, Lutaya ached living in Sweden as he worked to make a breakthrough. In 1986 and 1987, his hit song Born in Africa gave him what he had desired for a long time. At the time, President Yoweri Museveni had just shot his way to power, and Uganda was in post-war recovery mode. People looked out for songs that could rekindle their hope. The deadly HIV/AIDS virus was quickly spreading and killing people. The toll was so high that in some districts like Rakai, which was the epicenter, hundreds of families were wiped out. President Museveni's National Resistance Army, or NRA government, had a multitude of tasks to accomplish: poverty, restoring infrastructure, and tackling HIV/AIDS. Anti-HIV/AIDS messages were disseminated to the public, but many still related the disease to witchcraft or bad luck. Lutaya was a single father with 3 children, who he moved to Sweden in 1986. He returned to Uganda in 1988 to perform his Born in Africa song album at Lugogo. There are reports that before his big performance, Lutaya was always in and out of hospital treating fever. When he went back to Sweden, Lutaya tested for HIV, which turned positive. On 13th April 1989, Lutaya became the first public figure in Uganda to declare he had HIV/AIDS. The news shocked the country at a time HIV stigma was at all-time high. In fact, many people strongly felt that Lutaya was pulling stunts to sell his new music. This created controversy around his health and career.
I wanted to go on shouting loud about this crisis. I ignored people who were calling me a liar, people who were calling me an opportunist. I knew time would come when they would understand.
With his immunity compromised by HIV, Lutaya contracted tuberculosis and multiple tumors that weakened him, but he pushed himself to accomplish several music tasks. Sometimes he defied doctors' advice so as to complete his songs. Lutaya recorded a song that was to become the anti-AIDS anthem of sorts and the most important in his career, Alone.
Out there somewhere, alone and frightened. Oh, the darkness, the days are long.
But I couldn't let up because Alone had to be completed as my legacy to Uganda and the world.
Around my neck,
Take my hand now, I'm tired and lonely.
Lutaya looked physically strong, but internally, he knew death was lurking very close. He captured this well in the song.
Don't desert me.
He wanted to break the fear and stigma.
So, Philly, how do you feel mentally now? Mentally, I just feel the same. I'm the same man.
it's me.
Back in Uganda, sick and frail, Lutaya traveled to many primary and secondary schools and addressed public gatherings to spread the anti-HIV/AIDS message. Government supported him in this campaign. In August 1989, Lutaya was confined to a Stockholm hospital. He was now very sick. He was flown back to Uganda a few weeks later and passed away on 15th December 1989 at the age of 38. His music is very much alive, and every December, his Christmas songs top the charts in Uganda. Lutaya was named a hero and a lifetime achiever. The Philly Lutaya initiative